Good morning, everyone. Good morning, everyone.
Good morning.
I can
Good morning.
see. Good morning. Can I humbly request that those of us at the back should kindly move forward? Please, can I humbly request those people at the back to kindly, you know, start moving forward, please? Thank you. Just the same way I have asked the people sitting at the back to move forward, they've also asked me to move upward myself. Okay. Good morning to those of us on virtually joining us online. We really appreciate your time for convening this morning for this very important occasion where we're going to be setting the citizen-led agenda. This is one of those landmark events in the issue of Nigeria. Can we all stand up to recite the national prayer, please? One, two. O God of creation, direct our noble gods, guide our leaders right, help our youth to truth to know, in love and honesty to grow, living just and true. Amen. I think we a nation where peace and justice shall reign. Amen. And also in the national spirit of what just happened some few days ago, we want to have a 1 minute silence for the soul of the brethren, Nigerians that died in the train attack. 1 minute silence, please. Amen. Let their souls rest in peace, and the Lord grant our nation security and peace. Right? So once again, we're welcoming everyone to this event this morning. This morning, I'll be anchoring this event along with my boss, Dr. Francis Ohanyido. You're welcome, sir. So I'm not the only one that will be standing here. We'll be having self-introduction. We'd like to know those of us in the room. And while we'll call on those virtually to please introduce themselves by dropping by introducing. Okay. So those online will be joining you shortly. But while we are waiting for the technology to be properly set up, let's start with self-introduction in the house. Let me start from. They can hear us. Okay. So those online can hear us. So please start dropping your name and introduction on the chat room, and we are going to recognize you all. So let's start from here.
Hello, everybody. Hello, everybody, and thank you very much. I'm very, very happy to be here. Just coming from the US. I wrote a book on universal healthcare and access to the lower-income population. And this is a workshop that I'm very passionate about. I like this, and that's why I'm here to contribute what I can to the workshop. Thank you very much.
Good morning, everyone. I am Midia Adewale.
Good morning. I'm Celestine Okorie. I work for the Health Department.
Good morning, everyone. My name is Dr. Umar Tanku Yakase. I'm on the USC Forum.
Good morning, everybody. My name is Pakin Oyemakinde, and I work for Latvia Program as the Federal Technical Lead.
Good morning, everyone. The name remains Balama Boguje. I'm very pleased to be here today. I hope to not just be a meeting we are holding for the sake of having a meeting. The health agenda must be led by Congress from 2023. Thank you very much.
Good morning, all. My name is Francis Ohanyido. I'm the Director General of West African Institute of Public Health, and I'm going to be co-facilitating this workshop here today. And I look forward to a very, very fruitful deliberation among all of us here, because this is very strategic. In hindsight, if we had done this by 1999, it may have had an impact on our social sector in Nigeria. So, but hopefully, I think it's good to start here. Thank you very much.
Good morning, everyone. My name is Ayodele Olaoluwa. I'm here as a program assistant for Center for Accountability and Inclusive Development. Thank you.
Good morning, everyone. My name is Hawa Abbas. I work with Silver Lining for the Needy Initiative. Thank you. I'm looking forward to contributing, listening, and the after impact of this meeting. Thank you.
Good morning, everyone. Thank you for the opportunity. My name is Alex. I am the Opoli. I'm a medical student and I'm with Silver Lining Nigeria, and I am looking forward to this workshop. Thank you.
Good morning, everyone. My name is Okpe Abiodun. I am a PhD student studying public health with a focus on health systems. So I'm very happy to be here today and to learn from everyone and engage in this important discussion. Thank you.
Good morning, everyone. My name is Amanda Ijoma Obo. I work for International Society of Media and Public Health, and I'm excited to be here to learn and also engage. Thank you.
Morning, everyone. I'm Dr. Halima Adibaya. I'm a resident in the University of Ilorin Hospital, Department of
Good morning, everyone. My name is Peace, Program Officer for CAD.
Good morning. My name is Mark Isuma from Health Reform Foundation.
Good morning, everybody. My name is Honorable Mohammed Usman. I'm the chair of the National Advocates for Health.
Morning, everyone. My name is Benepe. I'm here with Mrs. Mukaji.
Morning. So my name is Kenneth. I work for Nigeria Health.
Good morning, everyone. My name is Kafayat Alawude. I work with DGI Consult.
Good morning, everyone. I'm Sekina Sanusi. I work for UT 2023 Secretariat. Thank you.
Hi, good morning, everyone. My name is Unyime Okpala, Partnership Focal Officer at Nigeria Center for Disease Control. Thank you.
Okay, good day, all. I'm Inyolo Atlola from DGI Consult.
Good morning, everyone. My name is Kingsley Ademawa. I work for Preston Associates. Thank you.
Good morning, everyone. My name is Thompson Obo. I work with NHIS, Abuja.
Okay, good morning all, and thank you very much for honoring our invitation. My name is Gafar Alaude. I work for DJI Consult, and I'm a co-convener for the USC 2023 forum. I hope we are going to do something which is very unique. As somebody says, we want to turn things around. We have to do different things and do things differently. So as a part of our process of doing different things and doing things differently, that's why we are here to articulate a clear agenda for the buy-in of the political class and the flag bearers into the political office. Thank you very much for coming.
Thank you so much, sir. And my own humble name is Anu Rotimi, Executive Director of Center for Accountability and Inclusive Development. Virtual persons, thank you all for waiting till now. We can see you all. I would love to call on Chatham House to please give their goodwill message for this occasion.
Many thanks, and the greetings from London. My name is Robert Yates, and I'm the
All right. My apologies for that. We need to have the open remarks first before we go into goodwill message.
Thank you very much. I think we are all in a hurry to ensure that we of course, accelerate what health means to us, means to national development. I'd like to recognize all of us that I you and the PhD students and all of us here, the nurse. In England, I called England this morning.
In England,
it's getting cold when we should be expecting spring. But all the same, the commitment that all of you have shown has been an encouragement to us. So I'll just quickly go to my welcome address, which is very short. Yeah. So first, let me heartily welcome all of us here today as we continue in our collective and deliberate efforts to put the health agenda forward. Since our first outing on December 16, 2021, we as the forum have continued to build stronger blocks of like minds who believe in our approach to ensure that universal health coverage is a reality. Today's engagement is to engender citizen-led health agenda workshops that will catalyze demand for improved health care. As a country, we are still witnessing huge gaps in the health sector, not only in service delivery, but in policy implementation. Recent research publication of Lancet Nigeria Commission and the just concluded Primary Health Care Summit findings expressly speaks to the fact that as a nation, we need to do things differently, such as giving health the political engine it needs to drive for sustainable improvement, create demand, ensure accountability, and efficient use of available resources. I'd like to stress that, available resources, because each time we demand for addition to resources, but how have we managed them to meeting our needs for us and getting people to stay, and of course, ensuring that human resources is also a big component of what we should be doing. Therefore, our mission is to define our vision as a nation. What does health look like? We speak to it, but really, are we in tune with exactly what is happening? Areas of strategic shift, how to do things differently. We're going to be looking at the universal health coverage, the primary health care, demographic dividend, higher level of care, and health security. Health security has become an imperative for us when we, what happened in Kaduna is, I think it's one of the warnings that we've had over the years, which we have not actually yielded to, because I'm sure some of the people who are wounded, if there was immediate and emergency intervention, on the side of health, maybe we can save some lives. So this is our drive, pushing health to the front burner of national development, taking advantage of the political climate as we prepare for 2023. And that's why we have invited political parties to these summits, so that together we can start fine-tuning what are the gaps, particularly giving it a political clout. I therefore welcome you to a very robust conversation as we deliberate and articulate not only commitment to improving healthcare, but putting health in the front burner, because ill health or anything that disturbs it has no barrier. Thank you. Welcome.
Thank you very much, Auntie Woji, for that very succinct welcome. So we'll go into the goodwill message section. We have a very robust partnership with different organizations. And one of them is a partnership with the Chatham House in the UK and the Center for Universal Health Coverage there, the think tank, the Global Policy think tank. And they are very excited to be part of this process. And I would like to invite Rob Yates to quickly give his virtual opening goodwill message. Rob, over to you, please.
Thank you very much, Gafar, and greetings from Chatham House in London. I'm just confirming that you can hear me in the auditorium there.
Loud and clear, Rob.
Marvelous, that's terrific. And I was just wondering, is it possible for me to be enabled to share my screen? Because I just have one or two slides to share with you, if that's possible. If it's not, I can manage without.
I was told you can share your screen, but probably you can just start saying some preliminary stuff, right?
Okay, yeah, unfortunately, yeah, the screen sharing. I beg pardon?
Yeah, I was just telling them to show your face. Okay, great. We are seeing you.
Oh, you're seeing me now. Marvelous, marvelous, and yes, and excellent. And I should be able to share my screen as well. So hopefully you're seeing just one or two slides now.
We can see your slide, Rob.
Marvelous, and I think it's so appropriate that you mentioned there that in the introduction about engaging politicians, because one feels that now is the time with the presidential elections to come up, to definitely put UHC on the front burner. I just want to suggest that now is the time for Nigeria's UHC hero to emerge. It was only just before the pandemic that Gro Harlem Brundtland, the former Director General of WHO, emphasized the obvious point that the only way that you can reach UHC is through public financing. You have to take that crucial step to replace private voluntary financing, people paying fees, with a publicly financed system, generally out of general taxation and social health insurance. And you can see from this graph that Nigeria has a tremendous opportunity to do that. That at present has very, very low levels of public spending as a share of GDP and very high levels of out-of-pocket spending, which of course is prohibiting people from accessing services and is impoverishing millions of people as well. So the route to UHC is all around increasing the public spending to crowd out that out-of-pocket spending that we know is so bad. But that takes political leadership. This process is always led by politicians right at the top of government. And I just want to sort of emphasize this point that one might be thinking that in this economic climate, that's going to be practically impossible to do because money's so tight. But the world has shown that actually it's out of crises that emerge great universal health systems, not least here in the UK, where I'm speaking to you from, and this is the architect of the NHS, Nye Bevan, launching the NHS after the aftermath of the Second World War. And in 2012, we celebrated our great success when hosting the Olympic Games. And this is sort of seen as one of the great achievements of the United Kingdom. You also have Prime Minister Thaksin in Thailand, who after the Asian financial crisis at the turn of the century, launched universal health reforms. When told by the World Bank that they couldn't afford to do this, he ignored that advice, introduced a universal health system, and is seen as a national hero in Thailand ever since. Another very interesting case is what happened in China after the SARS epidemic. when the Chinese government realized that it was, predominantly a privately financed system, it had gone the wrong way up that curve, and then announced spectacular increases in public financing in the order of $400 billion a year in tax financing to reduce the burden on households. So you can see that both social insurance and government spending went up, and it crowded out the private financing, and that being a tremendous achievement by the Chinese government. And you have other examples of leaders recently who have swept to power on the back of their universal health reforms. This is the then governor of Jakarta in Indonesia, Jokowi. I've even got my card from those days when I was working in Indonesia. And we were advising him on the potential to launch UHC reforms when he ran for president, which is exactly what he did. And he swept to power really on the basis of his UHC reforms. And there are other great examples of this happening right now. The Prime Minister of Pakistan, Imran Khan, saying that he's going to launch UHC system, a national welfare state, emerging out of the COVID crisis. South Africa is another very good example where after the transition from apartheid, that President Mandela, one of his first steps was to introduce free healthcare for pregnant women and children. And now President Ramaphosa is quite explicitly saying that coming out of the COVID crisis, he's going to finally launch in effect a South African NHS. So the big question, will Nigeria do it now? And this was the president speaking actually at Chatham House, actually before he ran the first time. I think if the truth be known, and we're being honest here, I don't think Nigeria has taken giant leaps to UHC over the last 8 years, but there is the potential, definite potential, for his successor to do exactly that. And we at Chatham House would be delighted to partner with yourselves in civil society and governors and political leaders. We're not party political ourselves. We'll talk to absolutely anyone, but anyone interested in running for office on a UHC platform, we'd be more than happy to talk to you. And one thinks that, this is the rationale behind this, that, COVID has been the biggest crisis in over a century. People are looking to their political leaders for quick wins, particularly around accessing health services and providing with people with financial protection. So promoting UHC reforms to political leaders, now is the time to do this. In fact, it was only a couple of weeks ago that Dr. Tedros, the DG of WHO, was in London for the CEPI replenishment. And I was talking to him at that event, and he said, yes, we must strike while the iron is hot. And the iron is super hot at the moment when it comes to UHC reforms. UHC can't wait, and we would be absolutely thrilled, as I say, to partner with any of you. So please do get in touch. I put my Twitter handle here, but Dr. Ghaffar will be able to share with you our email addresses as well. And we're ready to stand by you all in helping inspire and encourage the Nigeria's great UHC hero to grab the moment and become a national hero. Thank you very much indeed for giving me the time to speak to you today. Thank you.
So thank you very much, Rob. I think Rob deserves a stronger round of applause, please. I think from the presentation, a short presentation, we can see that globally, we've seen the country that made progress in the line of universal coverage. They actually make it a political process. And somebody once told me, if you want to be successful in life, you have to do what successful people are doing. And that is what we are just doing. We want to do differently now. So thank you very much, Rob. The partnership continues, and we have a lot of things to do. So we are continuing with the goodwill message, and I'll call representative of the ruling party, APC, George Imak, to quickly come forward to give the opening remarks quickly. So we hope the representative of other major political parties will join us in this process. Let's welcome George Imak from APC Secretariat.
Thank you very much, moderator. My name is George Emmanuel, and I'm pleased to be here. The APC, as a political party, has set health services as its priority. And we are seriously pleased to partner with you in making sure that we drive the health sector to the common man in the street, both in the local sector, local areas, and the state, and most importantly, the federal government. When my director called me to represent him, I told him it's pertinent for him to participate in this program so as to share his ideas or views on ways we can partner with USC. I want you to be rest assured that as a political party, we will integrate most of the recommendations made here in our manifesto. We are about to go into general election. A lot of people will come out to roll out their manifestos. But we will, because our brother here, who is the political office holder, knows that the party is supreme. On that note, we will make sure every political office holder take the recommendation of USC as a priority in their drive and in their governance. Yes, we understand the fact that there's difference between governance and partisan politics, but it's pertinent for every state government to prioritize health in their programs. And I want you to be assured that APC is ready to partner with you. Thank you.
Great, thank you very much. I think that is actually assuring, and we hope to hear same from other major political parties in the country. So I'll go to the civil society organization at the forefront of health advocacy in Nigeria. They did a great job towards ensuring that we have the National Health Act and the Basic Care Provision Fund and the others. So I'd like to invite Dr. Celestine Okori of the Health Reform Foundation of Nigeria. Over to you, sir.
Hello. Good morning, all. Greetings from the Health Reform Foundation of Nigeria, HEFON, and congratulations to the conveners of this workshop today for taking this great initiative of organizing a citizens' agenda development workshop for us to set a health manifesto for the political parties. This is most apt because we are going into an election year, and the major players or the major actors here are the political parties. Putting health on top of their agenda is a major initiative, which I think I have to congratulate the conveners for workshop. On my own part as HEFON, I wish to pledge our support, and we are going to work closely with this forum on whatever agenda we have set to carry out advocacy to make sure that it gets into the agenda of the political parties. We have experience with creating partnerships that works, partnerships that have succeeded in driving the health sector, and we would like to share our experiences with the organizers of this forum. So once again, congratulations to the organizers, and I wish the participants happy and successful deliberation. Thank you.
So thank you very much, Dr. Okori. So why we are very excited that HEFON will be with us on this. They have a great experience as articulated by Dr. Okori. So why Dr. Okori was giving a goodwill message, we have a representative of the World Health Organization here, our very good friends, and that have provided technical support towards defining health financing and policy in Nigeria and support its implementation. So I'm delighted to invite Dr. Francis Opuje to give a goodwill message. Over to you, Dr. Francis. The economist at the WHO.
Thank you very much, Dr. Gafar. Thank you, colleagues. Let me stand on the already established protocol. I bring you greetings from the WHO Nigeria representative, Dr. Walter Kazadi Mulumbo, who has asked me to join you today in this event, which for us is very important in the history of Nigeria. You know that universal health coverage is not a destination, but a journey. But most importantly, universal health coverage, just like Bob Yates was debating earlier, is a political decision. And indeed, no country achieves universal health coverage without strong political commitment. As the WHO in Nigeria, our work is to support the government of Nigeria in the business of promoting health, protecting the people, and serving the vulnerable. And in doing that, we will continue to provide technical support in every aspect of these health commitments that Nigeria have made, especially in achieving universal health coverage. So we are with you, both in body and in spirit. We will provide all the technical resources you will need from our own side to ensure that this happens. We're excited that we are going into the new political dispensation. So the politicking and the campaigns will soon start. So we'd like to see to the extent that we can drive health into the political agenda and manifesto of politicians. But most importantly, is not just to speak about them. What we would also like to see is ensuring that when these political gladiators take office, that we also work with them to ensure that what they have said they will do in health is done, so that our people will be saved from poverty when they access healthcare. Thank you once again, and on behalf of the WHO Nigeria representative, I want to congratulate you once more for putting this together, and hopefully we're going to work together to achieve the desired outcomes. Thank you.
Thank you very much. Let's appreciate Dr. Francis Okuje, who is representing the WR for the WHO Nigeria. Thanks for the assuring us that WHO is with us in this process, and thanks for the appreciating the importance of the process. So we still have a few more goodwill messages to go. We have somebody here who has done a lot of health advocacy, has led a lot of organizations, the immediate former country manager for a malaria project implemented by Malaria Consortium. She's our mom in the house. She's very, very vocal. She says it the way she sees it, and she does not color anything. So I'm delighted to invite Dr. Lola Bogunje to give us a real message.
Sorry, sir. It's not working. I thought, my dear. Okay. Oh. There's a saying for me, a messenger is as important as the message. You didn't introduce yourself from APC. We need to know who you are at this gathering. It's important for us because you are bringing a message, and we want to assess whether you are the right person to be here. Because for some of us, it is not a joke to be here. Ask Gafal, I didn't sleep all night imagining this meeting. So at the end of the day, I hope we'll have some, we'll keep pushing you people, we will keep pushing until the women, the children of Nigeria have a good health care. I'm not excluding the men, but once we can get somewhere, the men can join in. So I thank you for giving me the opportunity to say my words. I'll keep quiet today. I will not talk too much. Cousin, I can promise you that. Gafal, I should not talk. Go today. Go. Okay.
Thank you very much, Auntie Moji. What I forgot to say was that to tell us to wear our bulletproof when the Auntie Moji want to speak, because you never can tell how the direction of it's okay. Thank you very much. Don't worry, I'll come. So, so Auntie Lola, sorry. Absolutely. So we also have a representative of a very big reform project funded by FCDO. But at the same time, before that, his assignment as a member of FCDO, he occupied a very important position at the Federal Ministry of Health. He was once in charge of the planning, research, and statistics of the Federal Ministry of Health. We are happy to have a representative of a Lafayette project. Over to you, sir. Dr. Yemakinde is from Lafayette project. Thank you, sir.
Thank you very much. It's a pleasure to be here. Lafayette is excited to be at this kind of meeting. The epidemic that is with us right now, which is now endemic, has shown to us that except we prioritize health, we are not going to have any kind of development, economic development in this country. And how can we prioritize health if we don't place health on the political agenda? And this is why we're here. Placing health on the political agenda is such that it has been found that countries where health issues are prioritized as to be on the political agenda actually provide a lot of mileage when it comes to it. We want to see parties come forward and say, this is what we have for you citizens on health. The time is past when parties are silent on health issues. This COVID-19 has shown to us that we can no longer trivialize health issues in this country. We want to know, what do you have for health for the citizens of this country when it comes to health? You see, and this is why we are here. We are here because we want that health agenda to be citizen-driven. Hear the voice of the citizens. Know what they want. And please put it on the political agenda. In your manifestos, let us listen to you. Those people that are not putting health in their manifestos show that they don't have anything to offer the citizens when it comes to health. I want to say that openly. If you don't have health on your manifesto, it means you don't have anything to do with health and for the citizens of this country when it concerns health. And that is not good enough. So please, we are here to ensure that by the time we finish this deliberation, we all know the importance of health and why health needs to be on our manifesto. Thank you. Lafayette is in support of this meeting. Thank you very much.
So thank you very much, Dr. Oyemakinde. That is well taken. It's extremely important. In other climes, presidents and elective office holders are voted or not voted because of their content of their health manifesto. So I think we're moving to that in that direction gradually. Because of the importance of this program, somebody actually traveled away from the United States of America, and he said he wants to be part of this discussion. He belongs to the academics. He has written books on the universal health coverage in low and middle income country. I have the pleasure of inviting Dr. Izuma Ingu to give us a quick goodwill message. Dr. Izuma, all the way from the United States of America. You're welcome, sir.
Thank you very much, and thank you everyone for coming. This is a wonderful event. When Dr. Gafar told me about it, I was very excited. I've written a book on universal healthcare and access to low-income population. It was an exploration of capitation in Lagos, Nigeria. It was a long kind of research that was done, evidence-based research. I'm with the Streams Integrated Healthcare Services, and I'm really passionate about the informal sector and accessing healthcare. And I believe that what is happening today is a very important first step in implementing and integrating healthcare to the parties. And that is where we bring it down. A lot of times we have governors who don't have the requisite knowledge in healthcare, and having to convince them will take several years. Having this in the political agenda is excellent. It's an excellent idea, a great strategy to move forward. Thank you very much, and I'm happy to be here. Thanks.
Okay, thank you very much, Dr. Hingu. So when we talk about universal health coverage, there is one important organ of government that saddled with the responsibility of expanding access to care with financial protection. There is no other than the National Health Insurance Scheme, ably represented by Dr. Kufri, Abubakar Kufri. Dr. Abubakar Kufri, please, on behalf of the NHIS, I spoke with the ES because I know you have another event over there. Over to you, Dr. Kufri.
Thank you so much, Dr. Gafar. Good morning, all. Good morning, all. Let me first of all, I wanted to give a special regards to Dr. Lola, who I've worked under, and I really wanted to say it was an honor working under her. So for distinguished ladies and gentlemen, first of all, let me give the regards and the appreciation of the NHIS, ably led by the Executive Secretary, Professor Muhammad Nasir Sambo, who gives his goodwill messages here. And he also appreciates the convening of this meeting. As you are aware, the National Health Insurance Scheme is a central agency responsible for the provision of qualitative healthcare services that is affordable to all Nigerians. The NHIS is aware of its role as that strategic and central partner in ensuring that all Nigerians have universal health coverage. And it's because of this, under the able leadership of Professor M.N. Sambo, that the NHIS has undertaken series of deliberate high-impact reforms aimed at repositioning the health insurance ecosystem for the attainment of universal health coverage. One of these is the development of a comprehensive NHIS 10-year strategic plan, and that clearly outlines the processes and procedures of attainment of UHC in Nigeria, anchored on a sound and decentralized health insurance system. The second is actually the massive rollout of the eNHIS project, which is a process of ensuring that the entire health insurance ecosystem is integrated into an ICT-based system. The other processes is the development of the health insurance under one roof coordination framework, heavily supported by WHO and other development partners like the Life Year Project, to ensure that all the multiple stakeholders that work in the health insurance ecosystem are harmonized and integrated, and work in sync for the overall good of Nigerians. The other series of reforms that the NHIS has realized the challenge of accessibility to drugs, and we have rolled out a comprehensive NHIS, what we call the NHIS Medicine Supply Initiative, whereby we are pulling the private sector forces to ensure that we leverage on the economy of scale and ensure that we produce drugs that are qualitative, and also reduce the cost of drugs in the healthcare services. So these and other numerous reforms that are currently ongoing in the health insurance ecosystem, anchored by the NHIS, are a pointer to the fact that Nigeria is on the right trajectory towards the attainment of UHC, and that the NHIS is a central pillar in helping the country achieve this noble objective. Our appeal, therefore, is for all stakeholders to support the NHIS, rally around this organization to ensure that we move the country towards the ultimate goal of ensuring that UHC is attained. And let me appreciate everybody for coming here and the conveners of this forum, who are people who actually have the interest of this country in their hearts. And these are people who have deliberately fought for the health sector to become a topic in the political ecosystem in Nigeria. I wish us all the best, and please once more accept the regards and appreciations of the NHIS leadership and the entire staff of the NHIS. Thank you very much.
So thank you very much, Dr. Kufri, for that a goodwill message from the NHIS. Dr. Kufri, I hope you are here throughout because we should be part of the agenda so that there will be a collective ownership of the process. So the last but not the least, on the goodwill message, so that because our time is fast spent, I would like to invite, because a sector that is very, very important, whatever we do in this room, if the journalists are not with us, there's no way where other Nigerians will know what we are doing, and they should be part of this process. We are going to have a separate process where we are engaging the media, but as we articulate the agenda, we want them to start from the beginning. So I would like to invite Mrs. Ladi Bala, who is the president of the National Association of Women Journalists. Over to you, ma'am. That's rather weak. Could be stronger, right? Somebody said, it's only in Nigeria you appreciate people before they do the work. Eh?
Thank you very much. I really want to appreciate this opportunity given to me to be here. When I got this invitation 2 days ago, and I went through the invitation letter and looking at the issue that we're coming to be discussing today, I said this is one of the most noble initiatives and strategy that is needed for us to drive home the conversation about achieving universal health coverage in Nigeria. Indeed, health is wealth, and any nation, if you want to measure the development indices of a nation, the health status of the citizens of that nation comes first on the mind of anybody. Because without a healthy society, you cannot talk about development in our society. We cannot talk about having any space for anything that you can ever think of that will add to development. So health is very critical. And what excites me about this meeting today is the fact that we are here gathered to talk about the need of the citizen. It is a citizen-driven conversation, and that is the way to go. And more often than not, when it comes to electioneering period that we are into, 2023 is by the corner, health is the list of issues that come on the burner of politicians. We don't talk about health. Even Nigerians themselves don't talk about health. We talk about food, we talk about rice, we talk about every other thing except health. Even we as journalists, I think we have failed to a large extent because we have also never considered health as a major critical issue, that we need to put on the front burner to demand from our politicians, that this must also be included. Because without health, sincerely speaking, we are going nowhere. So I was challenged, having received this invitation. I said, indeed, there is a gap that needs to be bridged. And I'm happy that this conversation is taking place. So I want to commend the convener of this meeting. I want to also applaud the support of the Nigerian Governors Forum. Indeed, they are doing a lot. They've been supporting us. And so seeing them here, I say, wow, this is the way to go. So we are in this project. We are in this together. I represent the women journalists in Nigeria, but I want to assure you that you've challenged us, that we also need to take up our pen and begin to put the needful on the paper. We need to set agenda on this issue. Our politicians must indeed come to tell us what they have. How are they going to expand the health system? Because it needs to be strengthened. COVID-19 came to reveal a lot of things, that indeed our health system is weak. In a serious emergency situation, we will not be able to cope. So the time to start the conversation is now. And I'm happy that already a group has come up with this initiative. So I'm really delighted. I'm happy to be part of this movement. And I assure you that we as journalists, the NUJ president is on his way. I'm happy that he has also been invited. I am sure when he comes here, he will see that indeed we also need to sit up and make sure that we do the needful so that posterity will judge us right. Thank you very much for this opportunity.
Thank you very much, ma'am. Listening to you, actually, I had the impression that we have achieved our aims of this meeting. Thanks very, very much. I think that will be the last a goodwill message for now. As someone that would have loved to ask to give goodwill message, but because it's part of us, I won't do that. But let me give him a special recognition. His Honorable Mohammed Ahmed Usman, who is the former chair, deputy chair, House Committee on Health Services. He wears several caps. He's a politician himself. is a politician himself, and he's an advocate for health. So, and it's been very, very instrumental in terms of ensuring that we are able to navigate and engage the political class. We don't actually understand their language, but he's teaching us the language of the political class. Talking about the objective, I'll quickly show us the objectives so that we are clear in terms of what the objectives of this forum. Then I'll hand over to my my friend, my senior colleague, Dr. Francis Wahindu, to take us through the other aspects of the project. So in terms of our objectives, so that we are clear in terms of what we intend to achieve, first and foremost, I want to articulate a clear X-sector goals and objectives to be prioritized by the political class based on national priorities and international benchmarks as well. So if we are talking about putting health on the political front burner, what exactly do you want to achieve? We want to articulate it. And we are not reinventing anything. We look at the national priorities and benchmarks and international benchmarks as well. We articulate them and put them at the doorstep of the political class, both the political party and the flag bearers into the major elective position. Then secondly, I want to identify strategic shifts that should be engendered towards achieving health goals. It's not enough to say this is our goals. We should be able to identify what are the clear strategic shifts. What is the departure, areas of departure from the past that will take us there? Somebody says that we cannot continue to do things the same way and achieve different results. So we want to do things differently so that we achieve different results. And thirdly, I want to chart a course of action towards ensuring that the health manifesto translates to improved healthcare access. Where our shelves is already full in Nigeria, we don't want to add another just document for the purpose of adding it. We want to articulate a document that will be implemented so that it's not just, we are not wasting our time coming here. So that's an overview of the objectives of the workshop. And just to let you know that it's part of the beginning of the process, there are anti-Lola, there is a special engagement with the different political parties. We just thought it's good for them to be part of this process. But when we are done, we'll have different engagement with the political parties so that they will properly incorporate this. And we thank those that are here. So on this note, I would like to hand over to Dr. Francis Wahindu, who will continue anchoring this meeting. It's actually a chief, sorry, I forgot.
Thank you very much. So long as the red cap doesn't improve Nigeria, I don't think we're going anywhere with it. I think this is what will improve Nigeria. So I think let me say that we're here not for a talk shop. We're here for something that can be executed, and it's very important that we have that mindset so that whatever will come out of this talk shop is something that we can own and assure that it will be executed. And that's why the engagement with the political class is very key. And one of the things the next step we have to do is presentation, which will help give us some form of overview about where we're going to and what we need to do in terms of understanding what the next line of action will be like. So I think the first presentation here is actually supposed to have been by Dr. Ahmad Abdul-Wahab of the Nigerian Governors Forum, who is the senior health advisor there. But I don't think he's here yet. I understand he's on his way. Yeah, so we'll shift that. But I think we'll move up the presentation by Dr. Gafar. Dr. Gafar will be talking about putting UAC on the political front burner, the journey so far, so that we know where we are, where we're coming from, and where we want to go. And if you remember when my good friend Rob Yates was talking about earlier about the UAC, giving us a global understanding of UAC, he mentioned two things that were very, very critical. He mentioned the fact that most of the countries that have done well, for some reason, have prioritized health. And he gave us examples. And then the other thing he did was that the fact that he also said that in his conversation with another good friend, the WHO's Director General, Tedros, that Tedros had actually told him that, let me see if I got that right, that the iron is super hot for UAC at this moment. And I think for Nigeria, it's super hot for us. And even despite all the crises we're having, even within the political space, the poor political will and all of that. I think there's an opportunity, there's a silver lining somewhere out there. So it's left for us as citizens. That's why it is a citizen-led workshop, to be able to work towards that. So I want to call on Dr. Gafar. So Chief Gafar, let me give you your own red cap. Please come and take us through that presentation on the historical aspect of the UAC.
Okay, thank you very much. Though the cap is green this morning, so at the point probably to turn to red. Again, thank you very much, Dr. Francis, for setting the stage. So my task is actually very, very simple, to take us through a journey where we started from, the essence of the whole forum, what we have done so far, what we plan to do, and where we need the support of everyone. To start with, so there was this conversation with Auntie Moji in terms of all of us were expressing frustration about the health situation in Nigeria. And the question was that, what do we need to do differently? We have tried a lot of things. We have developed a lot of documents and all this stuff. And my response was that if you want to be successful, let's look at those that have been successful. What have they done differently? Can we attempt to do the same thing? Probably we are going to get a different result this time around. And it occurs to us that, a policy is essentially driven by politics. And wherever there is a policy document which is not backed by the political force, it remains just a document. And like Rob Yates said, Francis said, all the countries that made progress on the journey of universal recovery, they started the process as a political one. And we said, okay, let's try to take advantage of the forthcoming general election to put health on the political front burner. And that is how the journey started. And all of us have come together from wide arrays of our background, from the civil society, from partners, from academia to form the forum. Next slide, please. So, like I said, next slide. So, like I said, in terms of people that come together from indigenous organization, let me quickly emphasize that the whole forum, an idea, was led by indigenous organization. Of course, we receive very good support from partners and international organization as well. We have civil society, we have the media, and like I said, the donor agency. So what are the main objectives of the forum? The main objectives of the forum is to form a robust coalition and partnership among wide arrays of stakeholders towards putting health on the political front burner ahead of the 2023 election and beyond. And we have the opinion that for us to do that, we have to clearly articulate a UAC-related agenda to be adopted. If we are talking to the political class, what exactly do we want them to do? So we have the opinion that we need to clearly do that. But at the same time, we want to deepen the understanding of the various policymakers about the concept of universal recovery. What is universal recovery and what is not universal recovery? Because people have a lot of initiatives and activities and policy in the name of universal recovery, which will not lead them to universal health coverage. And then I think the media advocacy is very, very important. It is saddening that in the past, when we are engaging the political class in the election debate, people hardly ask questions about health, about interrogate the policy of the aspirant. So we want this thing to be different. So we want to heighten the police advocacy. And I'm very happy that the journalists are behind us in this. Thank you very much for that. And then we want to set up a mechanism for tracking progress. Like my friend, Dr. Francis Okuji said, it's not just about developing manifesto. We should have a very proper processes in place of tracking progress so that in the next dispensation, we know whether we are making progress or not in the process. Next slide. So in terms of our journey so far, so when we conceptualized this idea of this forum, the first thing we did as part of a commemoration of World UAC Day last year, we had a summit, which was well represented, and the And the theme was around putting health on the political front burner. We had a lot of politicians in attendance, the technical people. And part of what came out clearly was the need for us to articulate a roadmap and use it for very, very robust engagement. And then that is what we are doing just on the slide. So after the UAC 2023 summit in December, the members of the forum actually came together to design a clear roadmap in terms of going forward, what do we want to do, what should we prioritize, and what do we need. Next slide. And then we have like 5 major areas of intervention. And the first one is about developing health agenda, citizen-led health agenda. And that's the process we've just started. And in developing the citizen-led agenda, like I said, we want to, we are not doing anything new. We just want to reflect the national priorities and put them side by side international benchmarks. So that, and we want to be evidence-based. And luckily, in the process of putting this together, the Lancet Nigerian Commission actually came out, and we're very, very delighted. A very, very robust document that identified the health problems in Nigeria, the gaps, the challenges, and what we need to do differently. And it's actually provide a very, very robust background. And just last week, there was a very, very big conference on primary health care in Nigeria. And we want to see as much as possible, how do we bring to bear some of the key recommendations on this. Next slide. But let me quickly say this. Before we go into the group work, somebody will take us through the guide for the group work. But let me use this opportunity to say this. So in terms of a health manifesto, it is to have 2 components. The first component is articulating the result, what I call what success looks like. By engaging the political class, if we are very, very successful, we want to identify area of results. And of course, we have not defined it, but we have identified the areas. The remaining job will be done by all of us to identify it. So we identify 5 important areas that success looks like. And again, in terms of specific targets, we are going to define it. Number 1 is that what progress do we want to make in terms of universal health coverage progress? In terms of number of people that we want to cover, and I'm very sure NHIS already has a target and everything in that direction. And it's not only about just covering people, having numbers, having cards. We want to ensure that they have financial protection. It's not only about just having a card of health insurance. Then again, we want to define what progress looks like in terms of our primary healthcare system. What do we want to see? Like I said, we had a conference last week. So how do we articulate it so that we'll tell the political class? Then again, in terms of demographic dividend, don't forget that the health is not only contributing to improving health system, it's contributing to demographic dividend as well, so that we have more quality population, not just quantity, people that are able to contribute to the health system. So how do we define results along that line? Then again, don't let us forget that it's not only about primary health care. We are having epidemiological shift. There are a lot of diseases that are not very common before, but chronic diseases as well. So in terms of higher level of care, what does success looks like? So when we are engaging the political class, and don't let us forget the health security issue. So we want to define results along these 5 areas. And if the members of the group feel that there are other important areas, that's why we make provision for that. That is the first component of the health manifesto. The second component of the health manifesto, next slide, please, is the areas of strategic shifts. Like I said, what are those areas we want is major strategic shift. And the number 1 on that is what we call policy and resource optimization. In the health sector, we like asking for more money, for more money, for more money. But have we optimized the existing resources in terms of man, money, and materials? But don't let us forget policy as well. There are a lot of important policy instruments that we have not been implemented. So we have not optimized our policy environment, legal framework, strategies, and everything. How do we ensure we are optimizing them? That's the number 1 area of strategic shift. And number 2 area of strategic shift is area of sustainable financing and strategic investment. In terms of, all of us know that the health sector is grossly under. So what can we do to mobilize more money? But it's not only about mobilizing more money. What are those critical areas of investment where our money should go through? Then another area of strategic shift is an area of accountability framework. In terms of accountability, how do we hold everybody accountable? Accountable for policy implementation, accountable for resource optimization, and accountable for health system performance. How is our health system performing? The amount of money that was spent on primary healthcare system in the past 10 years, what result have we gotten for it? For the amount, the policy level that we've had, who is holding everybody accountable in terms of whether we have implemented or not? And then the resources that we are spending, how are we holding ourselves accountable? Then another area is the capacity of health institution in terms of what needs to change. Somebody says you cannot expect an 18th century institution to deliver a 21st century development agenda. So how do we ensure that we shift from 18th century institution to 21st century institution? And when I say institution, I mean administrative institution, regulatory institution, and service delivery institution as well, from the local, state, and the federal level. So that, because we should not be deceiving ourselves thinking that miracle will happen overnight. When we have the institution that are saddled with responsibility that they don't have the necessary input, they don't have the necessary skill, they don't have the necessary manpower to do it. What do we need to do? Then another areas of strategic shift is the citizen engagement. We often forget when designing intervention that are probably automatically our people will buy into it, and that is not true. So how do we ensure that we actually up our game in terms of engaging the citizen? And lastly, multisectoral collaboration and health in health policy. It is documented that half of the reduction in maternal mortality, under 5 mortality that we saw globally during MDG were due to intervention outside the health sector. Intervention in health, intervention in education, intervention in water resources, intervention, even the gender issues and all those. So how do we ensure that we integrate more with the other sectors as well? These are the areas of the strategic shift that we have identified. Next slide quickly. So we are of the opinion that if we are able to quickly articulate this, we are going to develop advocacy material, which we are going to use to engage the political class, engage the social, the media and others, so that we'll be able to do effective engagement. It's going to be a lot of work between now and the election period. And I was very happy when Francis said WHO will provide us with the technical support. I was very, very excited because we need a lot of technical support. There are a lot of areas where we need support as well. So advocacy material and engagement is very, very important. Next slide. So again, like I said earlier on, media is going to be very, very crucial. At the same time, we need to build the capacity of the media as well. You cannot give what you don't have. So that's why we really want to engage with them, so that they really understand the policy issues when it comes to universal health coverage. What are the challenges? What are the issues? And how do we communicate properly? And when we're talking about the media, we're using both the traditional and the new media as well to propagate as much as possible. Next slide. Again, perhaps more importantly, engagement with the party leadership, political gladiators to ensure that the citizen manifesto we have developed enter their manifesto. I think it's a very critical aspect of it. We have written letters of congratulatory messages to a lot of our political parties. We have invited them to this, and there will be bigger engagement. This is just, we are just setting the stage. We are meeting with the chair of all the major political parties and people that are responsible for drafting the manifesto to ensure that this the manifesto as well. And again, we are doing as part of our collaboration with the Chatham House in the UK. We'll be doing this engagement together. They'll be coming to Nigeria to work with us to engage the political parties from the chairman and other principals of the political parties. And not only them, like my friend from the APC Secretariat said, at times the party structure might be different from the governance arrangement, and the thinking of the flag bearer might be different from the thinking of the political party. So we're engaging them. This is part of the language that Honorable Usman is teaching us, and I'm learning fast from him. So as part of doing that, we'll be working with them. And at the same time, it's not only about local engagement. We want to see a situation where we'll go to Chatham House as well to have a debate. And we learn from experience. Why do we think this works? In 2017, I was in Chatham House, and interestingly, people that we ordinarily not see in workshop in Nigeria, I sat with them, we were on the same table. I was on the same table with El-Rufai. I was on the same table with the Chair Senate Committee on Health, Honorable Minister of Health. We are doing workshop together like we are mates. So it's part of what we want to leverage. So we'll do that in Chatham House as well. But Chatham House has told us they want to make it like another colonization, but a lot of work will be done locally as well. So next slide. Yeah, so one thing is to develop our advocacy material and everything. Another one is to make sure it is effectively disseminated. So we'll be working with a lot of media houses to ensure that our Earth Manifesto that we have developed is part of, we are able to disseminate it effectively through the traditional and social media as well, to work with the various election debate groups at the national and state level to have effective and robust collaboration with them so that we clearly ask questions around health policy during this debate as well. So we'll be working with media houses with very wide reaches so that we'll be able to disseminate as well. That's like. So on this note, I would like to thank you very much for listening to this presentation on the overview of the journey of the USC 2023 Forum. I don't know if there are questions or anything, but I would like to hand over to my friends. So thank you very much.
Thank you, Dr. Gafar. That was well delivered. Like he asked, are there any questions? Because as much as possible, we need to make sure that this forum is interactive. What success looks like, okay? Okay, what does success look like? Just came out just now. Okay, framing the results. What does success look like? Okay, you want to see it. Okay. Can you see clearly? Or does it need to be enlightened a little bit more? It looks at the result. What happened? Your laptop. So while we're waiting for that, are there any questions?
There's a question on, there's a comment online, if you can hear me. I have my hands up.
Do you want to put increase in domestic spending, or what's your thoughts on that? You know, out of pocket, I don't. If you have increase in domestic funding, to be offer more. If actually,
Okay. How soon can that be? Or you, okay, it's here, good. Kofi? Okay, Dr. Kofi, yes, please.
Yeah, thank you very much. There's just something that came up in the first PowerPoint that he presented regarding the issue of how to track progress and hold these political parties or the stakeholders accountable to their commitments. So I want to see in the group work that we do, how we can really develop like a matrix, you know, to actually track, you know, the implementations or the commitments that we're going to state here. Because it's one thing to develop policies in Nigeria, but it's always another thing to implement these policies. So really let's develop those mechanisms to ensure that we track the stakeholders to ensure that they implement what they are supposed to implement. Thank you.
All right, thank you. Dr. Kofi is talking in terms of making sure that accountability is there, and then that implementation becomes the mainstay of our desires to get to this level of implementation. Any other question? I saw hands. I know I saw a couple of hands. Dr. Celeste, were you raising your hand? Okay. I actually wanted you to raise your hand. Yes, sir.
Well, at the risk of again sounding like the same, but I think the last speaker reflected my thoughts precisely. When the presenter was here, really emphasized on the need to hold implementers accountable, and we seriously believe that is a gap that needs to be addressed. So if we have a good plan, we also need to have a plan that shows how we can achieve that, because when I looked at the plans he was presenting, I really didn't see that coming out very strongly. So for me, something that needs to leave us here is to say this is specific plans of how to do that accountability. Because he made a point, we spend so much money. Are we seeing the results? We really can't tell. So we really need to be able to say, we're giving you this money to do this. Have you done it? What percentage have you done? Have you done 50, 60? So that when you are asking for more, somebody can say, okay, this person did 70, 60. Indeed, this is something we need to put more money into, but we haven't had that for quite some time. Yes. Thank you very much.
Thank you.
Sorry, my name is Dr. Uzono. I'm with my colleague here. We're from NCDC. Our director is on our way. Hopefully she'll join us very soon. Thank you very much.
Thank you very much. Gafa, you noted that, right? Still on accountability. Okay. Yeah, so our participants online, are there any of you with comments, questions? Any comments? Hey, somebody.
Yes,
okay, yes, I can see hands. Okay, let's look at them from, yes, I'll call you. I can see your hands up. I can see Zoma one sign is up. There's Sunday. Is it Efon? Elom. Sunday Elom, and there's also Zachary Oshek. So let's start with Uzoma Wankwo. Please, Mr. Uzoma, can you unmute yourself?
Thank you very much, Dr. Francis. And greetings to everybody. My name is Uzoma Wankwo. I head the healthcare financing branch at the Federal Ministry of Health. I want to first congratulate the conveners of this forum and to say that this is an amazing task. It is not an easy one, it's a very huge and a very, very significant one. And without boring you with encomiums, let me just all aspects of the work that is costing for everyone who is trying to drive HC in the country, especially for the political class as 2023 is upon us. Now, it is not in for us to ensure health-related targets in the manifestos. I actually think that these politicians are not falling off the skies. They've been in the field, they've been playing, some of them have even already held office and governed. I think it's important that as we articulate this, we first do some research work. Let's find out who stood and held what position in all of the health-related debates that have happened in the past. Let's comb social media. Let us look at what evidence is out there, what they have said related to health, and how they've even tackled practically health-related issues. So that when you have before a debate, you put it to the person, on this issue, you said this or you did this. Now you're going for this office. Do you still feel the same way or not? Let it not be a situation where we just ask somebody, well, what are you going to do? They have a history. Can we take them up on what they have already done and then show that we ourselves have done our homework? And that could help us with really to, so that what we're hearing now go beyond rhetoric. So I'm putting it out there for those who are crafting these engagements with the political class and the aspirants and the political parties to have that bit, that homework, that team of young people who are going to come and get you evidence with which you can face these aspirants and put them to start. Thank you very much, and congratulations again.
Thank you, Zoma. If I hear you correctly, you're talking about being able to get information about some of these gladiators in our political space and being able to track what they have done in the past relating to health, their positions and all that. So, okay, that's a good one. Then there's also the other guy, is it Elom? Elom, are you still there?
Yeah, I'm here. I'm here.
Yes, please. Let's hear you.
Good day to you all. My name is Sunday Elom, a journalist. I work with the Orient Daily newspaper. Oka, Anambra State. First of all, I want to thank the organizers of this program. It's a wonderful one. Straight to my question. Looking at the topic of discussion is very, very important to both political office holders and the entire populace. But the problem has always been, as a journalist particularly, I'm speaking from the angle of journalist media holding these people to account, because most of discussion here is centered on accountability, because it's accountability that will bring positive results. So, but in several occasions, I've tried to track health-related projects attracted or initiated by political office holder, either in a constituency or local government level or even state level. But it has always been hard. You go to the facility, in particular primary health center, trying to find out the project, either building, either health materials that are supposed to be provided, and then you are denied access. You try to make further step to reach out to the person that attracted the project or initiated the project. The person keep mute, and then sometimes you receive threat that it's not your concern. So media here, please, the health experts and the organizers, how do you think media being involved in this program should be able to navigate and hold these people to account? I'm talking out of experience, and I believe if there are other journalists who have tried to make this move, may also have a similar experience. Thank you.
Thank you, Sunday Elom. You're talking about the challenges of media in terms of ensuring that the fourth estate maintains that level of accountability with our political actors. Incidentally, while you are talking, the president of Nigerian Union of Journalists walked in, and I'm happy that he probably caught some parts of what you were saying. You know, he's seated with our beautiful president of Nigerian Women Journalists. Yes. So I want to, yes, like on the side, the president of Nigerian Union of Journalists walked in, and he's in the person of Chris Isiguzo. Please, sir, can we recognize you? Thank you. You're welcome. So at least we have very senior members of the fourth estate of the realm, which is very important. They're the watchdogs with civil society to make sure that some of these things we're talking about don't go into the forest and grow bush. You know, so thank you, Mr. Isiguzo. I hope I pronounced it correct. Isiguzo. 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 Okay. Interesting. All right. You're welcome, sir. All right. Yes. Still online, online participants. Please, can you, yes. I think Zachary Osheku, you're still there?
Yes, I am.
Yes, please, sir. Can we hear you?
Okay. Good morning, everyone. In fact, I'm so elated being at this forum where an important issue that concerns everyone is being discussed, which is the issue of universal health coverage in Nigeria. First of all, my name is Zachary Osheku. I'm the Executive Director of Primary Healthcare Initiative Africa, and universal health coverage is at the center of what we do. Recently, we launched a campaign which we call My Health Sure campaign. It's a sustainable community-centered advocacy on universal health coverage, because we understood that Nigeria, day by day, keeps moving down into poverty. And a lot of people don't have access to 3 square meals per day. So what we did was, okay, how do we leverage the amount of recyclables in our environment, which have congested our environment? So what we are doing currently is leveraging on recyclables in the environment in exchange for a health insurance. And the reason why we're doing this, because we believe the whole pursuit for a universal health coverage has to be holistic, in as much as we are pushing for political leadership, we are also pushing for private sector engagement, because according to the private sector landscape assessment by the World Health Organization, about 50% of people depend on private sector for their health pursuits. So if you look at all this, you don't need to leave anyone behind. The government have to play their role, and the citizens have to play their role. There has to be as much advocacy as possible. And finally, on the area of investment, in 2021, 2001, there was Abuja Declaration where all the African member countries met here in Abuja and unanimously agreed that 15% of the budget should go to health. And unfortunately, about 21 years thereabout, Nigeria has never had a budget of even up to 10%. So this is the best time for us to call for more investments in the health sector. Based on the assessment we do at the facilities, as we go in the field, we realize that some of the persons, the enrollees under the Basic Healthcare Provision Fund that were supposed to benefit from health cover, it will shock you. At the facility, they will tell you they don't have ACT anti-malaria. They don't have this. So why do you expect them to get quality care? You know, so we notice there is a gap between the facility and the medical store in most of all these states. So what that tells you, there is a funding gap in terms of procurement, supply chain management, and what have you. So it's an holistic process. Every hand needs to be on deck if truly we are serious in advancing the cause of universal health coverage in Nigeria. Thank you.
Zachary, for that intervention on your part. If I hear you very well, you're also looking at the issue of increasing funding for health, especially domestic funding for health with Nigeria as your particular area of interest. And you brought up the 2001 Abuja Declaration. Yes, we agree with you. It's actually very shameful that a country that hosted the thing has not moved an inch in terms of trying to meet up with that goal. That is one of the reasons why we're here. And I think that's part of what we're trying to do, get the political class to see those things, to sell them a picture for the moment, and something that can bind by evidence, and to make them understand that we cannot have a Nigeria without that level of intervention. Thank you very much, Osheku. There's somebody else there. Yes, Chris Amalu. Chris, then we'll go to the Secretary General of Chan. I think I can see him there, Dr. Mike Ida. But before Mike Ida, Chris, I think I can see your hand. You're muted. We can't hear you, Amalu. Chris, are you there? Okay, we can't hear you and we don't have time, so we don't have that luxury. So I'll move over to, please mute yourself. I'll move over to Mike Ida. Mike, you can introduce yourself. You're not a stranger to some of us here. Please. You are muted. You are muted, Mike. Unmute yourself.
Can you hear me now?
Very well.
All right, thanks. First, thanks, Francis, for recognizing my hand. And let me also join others in thanking the organizers of this forum. I think it's coming at the right time, even though during the introduction I heard, if we had done this in 1999, we would have gone further than where we are and the impact would have been registered. But all the same, I have a little concern to share that just as one of the last few persons that spoke said, all hands need to be on deck. And the political engagement is not only at the national level, we need to recognize that the issue of universal health coverage is even, affects people more at the rural areas, in crisis zones, in hard to reach areas. And we're in this kind of forum, I don't understand, or I'm not in a picture to how much the faith-based organizations and some community-based organizations are carried along in this discussion, so that the agreements and the strategies are also affecting promoting a bottom-up approach so that we can really have a diversity and a convergence at the center. So I look forward to really seeing where the faith-based organizations that are working in very remote areas and communities of the country are also strengthened to be able to really engage with local government councillors, local government chairmen, even the church leaders when they go to pray for them to succeed. And the questions will be, what are you doing in the area of health? Because health affects everyone and doesn't know religion, doesn't know culture. And so in all that we're articulating, and like the presenter said, to strengthen the entire health system, I think faith-based organizations, community-based organizations, in addition to all the civil society organizations, need to work collaboratively towards ensuring that UHC is attained in Nigeria and very fast, and that we take this strategy on and as fast as possible before the electioneering processes gain momentum. That will be my little contribution, and I'm willing, and as CHAN, we are committed to also seeing that we work together. Briefly, CHAN is a member association connecting all the Christian health institutions in the entire country, and we have been in existence for nearly 50 years now, and we have a network of over 700 health facilities. A lot, and over 70% are working in rural areas, and universal health coverage is top on our agenda also, and we'd like to really work with people who can share ideas and promote and ensure success that we attain universal health coverage in Nigeria. Thank you, and over.
Thank you, Mike. Thank you very much. Your intervention is well noted. The Mike was actually bringing in the issue to be sure that the faith-based organizations are carried along because they are major stakeholders. You can hear the whopping number of facilities they supervise, over 700, and I know some of them are even tertiary facilities. At least 7 of them are tertiary. So the same thing with the other organizations in the health sector too, playing quietly in the background, and it's important that moving forward, he's recommending that we ensure that they are carried along through this process because they are major stakeholders. Thank you, Mike. Yes, back to Chris.
Yeah.
You are the last person.
Yeah, hello.
Hello?
Hello.
Chris, we can hear you.
Yeah, hello. Can you hear me now?
We can hear you, sir.
Okay, great. Please, I want to send my regards to all the presenters, Dr. Gafer, for the good presentation. Mine will be coming as a solutions I'm trying to provide here. One is that based on the need for accountability, my suggestion is that there is need to set up a national and electronic dashboard where the states can actually have the publication of the universal health coverage as a scorecard, and individuals and CSOs can have access and reference those scorecard per state. That way we also have a credible source. Sorry? Hello? Hello?
Go ahead, we can hear you.
Yeah, okay, good. Yeah, then on the second point, I'm also recommending that the scorecard can also be routinely published in major national dailies. This will help in holding the leadership of these different states accountable in terms of the universal health coverage. This approach was actually adopted by Health Reform Foundation of Nigeria sometime in tracking immunization coverage in Nigeria, where one of the states we are publishing red, and the then governor had no option than asking them to do the right thing. So I think that if we do this, it will help in holding the leadership accountable. Once more, my name is Chris Amalo. I am was a national consultant to Nigerian Governors Forum and also the program director, Royal Healthcare Foundation. Currently, coordinator and secretary, Governor's Task Force on COVID-19 Containment, Enugu State. Over. Thank you.
Thank you, Chris. If you're hearing me, we lost part of your initial intervention. Yes, but basically, I think we have a picture of what you're saying is, Chris, I think if I heard him right, he's talking about a sort of peer review mechanism for states to be able to track how they are performing in terms of using like a scorecard where maybe name and shame sort of thing. So, but I think that is very, and the example he gave about HEFON, I'm very, very aware of that. HEFON did that around immunization, and they were able to put up scorecards for every state in Nigeria and to be able to show how they were performing on the immunization indicators. So thank you very much, Chris. Is there anybody else online?
Thank you very much.
Nobody else online that wants to talk. Okay. So I think back to the house or those present here. Is there anybody with comments, questions again? Okay, until Allah has.
Nigerian Governors Forum had something like a scorecard. Maybe I'm mixing it up because sometimes you can mix up now. But the point is they don't publish it for the people to see. So it's not for Nigerian Governors Forum to have a scorecard and their docker. It's for them to publish those scorecards so that we can actually talk about it. They have it for NHIS. So I just have to say that.
Al-Wahab is not around yet. But what Dr. Lola is saying is basically that there's also a mechanism, a sort of accountability mechanism that the Nigerian Governors Forum has, but it's an internal thing. But she thinks that it should be citizen-oriented in the sense that whatever they do, they can share it out there, because it's not just to just use it for their own work in terms of this, but it will be more powerful if the people are aware of those performances across the states. So that's, I think, what you're saying, ma. Yes. So that if it's if people can see it, it will have more impact in terms of how they even engage the politicians and all that. I need to recognize somebody from the political space here. There's Scholastica Kanebi. Madam, you're welcome. She is the head of department, Women Affairs for PDP. Can you give her a round of applause? So, madam, do we take it that the women are taking over? All right, very good. This is the last day of the Women's Month. Yeah, it's good to have you people here. So, yes, is there any other comments here? Any other? Yes, sir.
Yes, thank you very much. This is a very spirited discussion that we're having here. One of the things I was actually looking forward to, and I hope that we will get to developing this, is a set of benchmarks or a checklist that will determine, where the actually be able to say that the healthcare, a governor or say that healthcare is really implemented in their state or can be implemented in their state. There are other things that I'm also thinking about, which is based on the international standards for healthcare, that we need to explore a lot of the private healthcare centers and determine whether they're meeting standards. And I know that licensing issues, but supplies are not in place. If we have people who are monitoring those and providing licenses or having some dashboard that shows what is there and what is not, then we will be able to have folks, even those in diaspora, help to supply those equipment or fund some of the resources that are needed in those areas. There are so many things we can talk about, but more importantly, having the political parties know exactly what it means by health care. If they want to implement healthcare in their state, what are the various things that you have to do to fully implement the healthcare, if it is universal healthcare? how to get the informal sector into the healthcare pool, and how to get the resources into those pools. If we can get a list or a document that would be given to these to the political parties, and like somebody mentioned, to all the press, when they're having the debate, to also talk about it, that would be excellent. Thank you. Dr. Izuma Ngwu, Streams Integrated Healthcare Services.
Dr. Izuma took it to the next level. He talked about things relating to still yet in terms of accountability. He looked at the issues of having a system for standards. And incidentally, the National Health Act of Nigeria provides for a certificate of standard. The only problem is that we have not gotten the rein of how to implement it. So that if you are setting up a primary health facility, whether you're private or government, there should be a modicum of a standard you have to meet to set up that facility. So the National Health Act actually specifies that. The only problem is that, like most things, we have not been able to implement that component of the National Health Act effectively. So it speaks to that. Then and that's also dovetails into the issue of even private sector, getting them on board, making sure they meet that modicum of standard that you have already put there and all that. And then the monitoring that you talked about, because once that is there, you make sure that that standard is met, and then you also be able to make sure you close those that standard. But there are a lot of challenges around that. But I think this is also part of the convention pieces that we can put in place for the political actors, because they are the ones who have both the knife and the bread, and they are the ones who can distribute those resources in that sense of it. But very good thought. And I think it's something that before you go into the breakout sessions, people should also be thinking around that level. How do we get this accountability to that level? Whether in terms of getting those dashboards, getting the political actors in their states to be able to define what. So in fact, I think one of the things I picked from what you said is a sort of being able to have what you can call political health literacy. Because a lot of the actors don't even understand what we're talking about. Most times we talk to ourselves in this space. So I think if I get Dr. Izuma right, political health literacy is also one of the key things we should drive on this agenda. Thank you very much. Any other thoughts? You want?
So I want to take the discussion to another level altogether. And indeed, part of what some of us have discussed previously, and it stems from what you mentioned last. So to ensure that we have people who also understand health. So to what extent are we going to incentivize people who are sitting in this room, who understand what we need in health, to also take active part in governance and in politics? The reason I'm saying that is you are very correct when you say we are talking to ourselves. And often we sit down and lament among ourselves how things are not going well. So part of the UHC 2023 forum objectives, and I'm going to strictly solicit that you put it as part of your objective, is incentivizing people among this forum, people who understand health, people who have passion for health, to go straight into politics.
Good one. Give him a round of applause. I think the biggest actor that can be in that China house, China store, is the person who understands it. You know, people like my good brother here, namesake Francis. If we can get Francis to become a commissioner for health. Yes. So, but the point is that it is one thing to talk. It is time for us to also enter that space. That's what he's saying. That it's time for us, those who feel they have that passion for it, to enter that space and make that difference. Because the problem there is that in 1999, there was a lacuna. Most of those and the distrust of the military. So when 1999 came, quite a number of people who got into politics entered out of opportunity. So now it's time for people who understand these things. And at the base of all these things, the social sector. If we don't have a social sector in Nigeria, we will not have a Nigeria. Once we don't get education right, we don't get health right, there'll be no Nigeria. Every other thing cannot fall into place. We must get those two things right. And it's better that people who understand them can be there and be able to act effectively. Yes, so yeah, I'll take one more online. I can see a Dr. Opeyemi Adeosun.
Yeah.
Opeyemi.
Yes, sir. Good afternoon.
Yes, please.
I hope I'm audible enough.
Yes, you are.
Okay. My name is Opeyemi Adeosun from Airphone. I would just like to take this a bit forward when someone made suggestion about making scorecard, which is fantastic. But I also think that as stakeholders, we need to do beyond that. One of the concepts of accountability framework is reward and sanction. Yeah, these guys we are talking about, the political class, they are our leaders. And one thing we have all agreed is that we have to hold them accountable. Now, where does reward and sanction comes? If they make promises and they are not standing by it, how do we sanction them? Are there ways? I think we need to start thinking of steps we can take as CSOs, as media, and other relevant stakeholders to also hold them accountable and sanction them. And the ones that are doing well, we find a way to reward them. I mean, that's just my own thought. Over.
Yes, thank you, Opeyemi. What you brought in there is very, very important because we've been talking here mostly about developing scorecards, developing all sorts of accountability systems. But you have emphasized the other end of it, which is about a reward system, a sanction system. And it's something that we also need to start thinking about. What dimensions can these things take? How can we be able to sanction those gladiators? You know, like somebody said that here we practice rulership, not leadership. So how do you sanction your ruler? So it's an interesting space. So it's also something that I want you all to put at the back of your mind when you go into that breakout session, as you're talking about even putting in place these mechanisms. What can we see as reward systems and the sanction systems that can be people-driven, that we can put in place? Is it only during voting that we can sanction people? There should be other ways that we can sanction people. So put that at the back of your mind. Thank you, Opeyemi, for raising that. Thank you very much. Yes, so all right, so the next thing we're going to have here is I'm going to call on my co-facilitator here, Anu. She will take you through the group work guideline and explain what you are going to do when we go into the breakout session.
So thank you so much, everyone. And I know it's time for tea break. I'm just the person standing between us and our tea break, but we'll be going for tea break in just about 5 minutes. First, let me go straight to the online participants. The online participants too will be grouped into 6 groups. We are going to have 6 groups for the online participants. And if you check the chat room, we can still share the group work guide. So we want you to go into the group work in 6. You're going to appoint a moderator, appoint a secretary or a rapporteur, someone that will share your whatever you worked on in the group. Each group we have group 1 online. We work on 1 group, and other one we work on 2, 3 like that. So that's what we're going to have virtually. Now, for those of us in the we're going to be having 3 groups. Ayomide, can you share the group work, please, virtually, so that we can all see it? So those of us in the room, we're going to be in 3 groups, and we're going to be having group 1. We're going to be doing random grouping. but we want to be specifically say these following persons will be in the following groups. Dr. Yemakinde and Dr. Francis of WHO will be in group 1, while Dr. Celestine Okorie and Dr. Yakasai will be in group 2, while Dr. Francis Ohanyido and Dr. Gafar will be in group 3. Dr. Kofi NHIS, please join group 1. So let's take randomly numbers. Let's also have random numbers now. So can I have
don't want to go. You don't see. When will I come back? I haven't done that. I'll go. You will follow me. Go and sit down. Eat now. Stop following me. So you know that I'm going.
Hello, everyone. Can you hear me, please?
Yes, we can hear you.
Okay, so sorry about earlier. I realized a lot of us were in groups and the group works were not going on. So I decided to close them out so that we can start all over again. So I shared the group work guide. We shared the group work guide in the chat box. I'll share it again now. And there will be 3 groups, and each group is going to work on 2 result area and 2 intervention areas that are already on the guide. But please feel free to add other intervention areas and result areas that you feel may be relevant in your group. And there are also some indicative indicators for the result areas. So I'm really sorry. Can someone hear me now? My husband was on for a minute.
We barely hear you.
Okay, what about now, please?
Yeah, I think that's okay.
Okay, so
I think it's okay too.
Everyone here will be split.
Ayomide is trying to engage.
In the group work guide, we currently have so I'm going to share my screen so that we can see what it looks like. It was presented earlier, but I don't think everyone got to see it. So can everyone see my screen, please? Please let me know if you can see my screen, anyone.
Yes.
Okay, so this is what the group work guide looks like. We have 5 result areas for now and some indicators for those result areas. The indicators are not so we are going to split everyone into 6 groups. So each group will work on, group 1 will work on result area 1 and 2, group 2 will work on 3 and 4, and group 3 will work on 5. Each group is free to come up with other result areas, and these indicators, like I said, they are only indicative. So you can have more indicators for each result area and the targets and timelines. So earlier on, we agreed the major timeline should generally be the ending of the next administration that is going to assume office by 2023. So the timeline will be the next 4 years from that, that's 2027. So And then we have some intervention areas that we have listed here. So we have the intervention areas are policy and resource optimization, sustainable financing and strategic investment, raising the accountability bar for health system performance, enhanced citizens engagement, strengthening the capacity of health institutions at all levels, multi-sectoral collaboration and health in all policies. And then we have others. So each group again is going to work on, two result areas, two intervention areas. So some background for these intervention areas have been provided. So what each group is expected to do is to articulate policy interventions that we would like to see for each of these intervention areas. And there is also room to add other intervention areas that may have been left out. The list is not exhaustive. So please, each group can come up with other intervention areas, provide a brief of the addressed and also the policy interventions. So I'm going to share this once again in the chat box. Every group is going to have a moderator so that you can moderate the session, and every group is also going to have you can assign for use, and that would eventually also present what you've worked on in the group. So please, if you have any questions, let me know before we proceed to breaking out in groups. Any questions, please? Please, you can raise your hand if you have any questions before I make the breakout rooms. Okay, so there are no questions. I'm going to split everyone into different groups now. I have shared the
Well, sorry, please. I cannot find what you have shared on the chat.
Okay, it's a Word document. Let me share it again. Okay, do you see it now, please?
No,
I just shared it again.
I can't find it, but I don't know if others are seeing it. But I doubt.
Yes, I can see it. It's on the chat box.
Yes, I can see it.
I can also see that I've downloaded the first one.
Wow. So how come I'm not seeing it?
All right,
How
so
come?
please, I'm going to share people into breakout rooms now. And once we go out into rooms, please, in your group, let's immediately assign a moderator and a secretary so that people can start to work on the group work guide. Please let me know if you have any questions. I'm about to snap. Okay, hello everyone. Hello everyone. Dr. Adios. All right, thank you for joining back. I've made you a co-host. Please just join room 3 back. You can join room 3 back now.
Okay,
Join
please. Yeah. I want to say briefly, I may not be here for that 40 minutes long, so I don't know.
No problem. Just join breakout room 3. Once we are done with the group work, you can
Okay.
share the file with me, then somebody else from the group will present.
Okay, all right.
Yes, so I will just send my email address to you now so that you can share it with me.
Okay. So to get it clear again, so we're just talking about health security as regards the indicator joint external evaluation score, right?
Yes, and also the intervention areas that you discussed earlier and the notes that you took.
All right, beautiful.
Yes. Please join room 3 and share your screen. Thank you.
All right. How do I do that? Okay. Okay. I'm looking at 3. I think you'll be the one to do that. I can't find it. Hello.
Hello, can you find it now?
Okay. No, not exactly. There's no room here. I think you will be the one to break me out, I guess.
All right, okay, just give me a moment to do that. Thank you very much, everyone. So for each group, please, the people that took notes, be prepared to present the output of our group. So we're going to join the general session back now.
Which is the technical and administrative arm of that forum. And what the Secretariat does is like we're the policy hub that helps shape the discussions that are happening at the forum. So we have different group of experts. So there's a health unit. We have a health unit. We have our finance. We have legal. We have economic. We have agri. We have education, where you have experts that deliberate on issues. So for us at the health sector, we have what we have outlined as 4 key priority intervention areas. First on the list is actually universal health coverage. 2 is talk of nutrition. 3rd is where we started from polio and routine immunization. And then with the coming of COVID, now we've added health sector, health security as part of those 4 priority areas. And then when you talk about UHC, you know, UHC is all encompassing. And even for UHC, we try to unbundle it in trying to strengthen primary health care, ensure the issue of health financing by financial protection, promoting innovative areas to finance the health sector, particularly pushing for the state social health insurance. And then the 4th one is actually pushing for availability of drugs. So we try to do this. And because, yes, we are technical people working in a political environment, so we have to look at things that they are both politically, they are technically sound, but are also politically expedient. So if you can put both together, you can be able to sell those interventions. I think that is acceptable. So that's what we do, I mean, at the forum. And because UHC is one of our priority areas, that was why this UHC forum, we are actively supporting it. But I think even more importantly is the UHC forum is Nigerian-owned, Nigerian-led. So it's a group of Nigerians that come together that is trying to push this agenda. It's not that we can't do this ourselves. We always believe that we can do this. And that is another core reason why the Secretariat is actively involved. And we even went as far to say that we're going to sign MOU with the UHC forum, just to make sure that whatever the UHC is going to do, we'll support it. So when we had that discussion about having, what do we call it, citizen-led health agenda that we want to sell to the political class, you know, of course, this is something that the NGF has to be interested, because we have our principals are politicians. And what we're saying is we should be able to get those interventions that will be able to pass to these politicians, that they can be able to talk to the people, so that, yes, when they promise these things to the people and they implement it, it is going to benefit both them. It will benefit them politically, but more importantly, it's going to benefit the citizens. And that is why we think this is very important. And for us, maybe in terms of what Dr. Gafar is asking me to talk about, that when we want to engage with the political class, first thing we have to put in mind is when we are talking, a governor is a governor of all sectors. It's not just governor of Ministry of Health. It's not just governor of health sector. So the way you are saying that health is important, that's how other sectors will also come and make it to show you that their own sector is equally very important. So we have to have this in mind in terms of whatever we want to pitch. While we should think holistically, if we happen to have interventions that, yes, it's health, but in a way it benefits everyone. So you see that one is very easy to sell. So in trying to get a health agenda for the political class, we have to look at those interventions that benefit what we call it, the populace. When you do it, it's something that is going to be beneficial. And then when a politician talks to the populace about it, it's something that they can relate with and they can understand. So when we sit at the forum, we have a lot of people that say they want to talk to government. When we ask them, they will come and make some very fine slides. By the time they come with that presentation, when you look at it, it's technically very fine, but it's dead. By the time they finish presentation, nobody understood what they have. And that in terms of what are the key asks that they want governors to do, more often than not, the key asks are something that is supposed to be done by the technical people, not things that the governors are doing. And so what we try to encourage is, anytime you want to act, look at things that you know the governor himself is that there are key things that you know they are directly responsible. And you try to hold them for that. And most of these things are not those outcome indicators that we usually present as technical people. But I think we call this group of indicators, we call them enablers. So you have these enablers, you try to look at those enablers that the governors need to put in place that will actually help technical people for them to be able to do their job. So for me, I think this workshop, maybe I'm going to be one of the biggest beneficiaries, because some of the issues that we are going to come up with at the end of this workshop are some of the things that we are going to be presented. I know we have three phases. You have the pre-election area during the campaign and everything. There are issues that we want to put there. But when they win, which is the one that we deal with, which are the ones that we deal with, when they win, then we are now a governor, we sit with them. Those interventions that we need to solve with governors, those ones are also going to be helpful. So I believe that by the end of this workshop, we'll be able to come with those politically correct, technically sound interventions that we can be able to solve with the full class. Please, let's not get bogged down with things that are very technically sound. There are things that are technically sound, but it doesn't. When you go and sell it to the public, people, it will just be above their head. They're not going to understand it. So let's look at things that general public will be able to understand. And I think with the kind of people we have in this place, I know we'll be able to come up with most of those very great interventions. So once again, I really want to thank you for being part of this, being invited to be part of this development tonight. And I can assure you that for us, some of these things that come up from here, we are going to do this for the advancement of the agenda. Thank you very much.
So I think Dr. Hamad deserves a stronger round of applause, please. So thank you very much, Dr. Hamad. We are in together, and all those the wealth of experience you've gathered interacting with the governors is going to be very, very useful as you put health on the political front border. So when Dr. Hamad was giving us his goodwill message, if a powerful guy walked in, and is somebody that has been an advocate of putting health on political front burner. Actually, that coinage, putting health on political front burner, we actually took it from him. It's somebody that we have learned a lot from, has been the leader in the health sector in Nigeria. And of course, he has been around for many years and led a lot of good initiatives in the health sector. Some of us are his product of a school of thoughts. And we learned a lot of good things from him, including some bad ones as well. And one of the bad ones, he has demonstrated this. So if you see me shake somebody and I squeeze your hand and also something, it's part of what I learned from Oga Mike. So we are very happy to see Oga Mike here. He's an authority when it comes to development in Nigeria and globally. And we are highly privileged to have you. Oga Mike, you have the floor, sir. To greet us and squeeze our hands.
Good afternoon. Good afternoon. Some people are looking at me as a stranger. I'm sorry to come. I didn't come late. I was supposed to be here by 9 and I was ready for 9, but I had to go check my leg. I'm glad to be here. I think we're doing the right thing, and I want to congratulate the organizers for this. It's the right thing to do. I'll give you a little bit of background so that we can understand. When I get angry, you know why I'm angry. But since I was invited, I know that those who invited me were ready to take my nonsense. Are you ready? Okay. I will just briefly say why. I think this is a good job. But the question is, so what? We've done this, we're developing, what do you call it? Manifesto. Manifesto without manifestation is useless. Manifesto. If you are working on your phone, drop it because you'll be rude to me. If you have your phone and you're working on it, drop it. Even though I have one leg paining me, I know how to work out. That's one thing I learned, to use my leg and use my mouth. Because we're here to listen. You know, Moji is here. And I want to give you some historical background. When Gafar was talking, I listened to him. The question I have is, what do we need to do differently? There have been so many attempts to put, come, I'm a teacher, I will make you to stand up. You are not my age. So let us, while I am two of you, are you my age? Are you close to 70? Okay, it doesn't work that way. President is not my president. Okay, so let's, thank you. Those are the nonsense I talked about. You know, I think some years back, in an attempt to put health on political agenda, not just political agenda, front burner of political agenda, that's the right word. We sponsored, Pathfinder sponsored 4 legislators, 3 senators, Senator Khairat Gwadabe, Senator Zego Aziz from Kaduna, Senator from Ibadan North, is it Ibadan something, what's his name now? And a legislator from Ebonyi State. And then several development partners. Pathfinder paid PGA, which is Parliamentarian for Global Action. Parliamentarian for Global Action. The late Professor, what's his name now? The Ghanaian, famous professor. He was the one that coordinated it. We paid them in New York. We took Nigerians to Ghana to see the health system in Ghana, to see the parliament. We were welcome to the parliament in Ghana. We were in a session with them. The Ghanaian government gave us an aircraft, an Air Force jet, to take us to the northern part of Ghana. We studied how the Ghanaian health system was set up. They did some work. Southern region, middle region, and northern region. And then developed their work. That's why you have Ghana Health Services today and a lean Federal Ministry of Health. We went to Navrongo. We looked at everything, you know, and I can tell you the 3 senators did not come back because most of them said, particularly Zego Aziz from Kaduna State, said, this is something I would like to continue to do. I'm not going for a second term. because they saw how development was being done. So we exposed them. We exposed the parliament to how things are being done. They found out that Ghanaian parliamentarians are being carried in postal buses to and from office. I'm not going to talk about Nigeria. I'm just telling you what is happening there. You know what goes on here. You know? So that was one. The second experience was ICASA 2003 in Nairobi. We had 6 legislators to attend. I made a presentation, not going to. I made a presentation on the role of parliament in fighting HIV. In the midnight, I was waking up just before the time that, oh, Nigerian parliamentarians are here. They don't have rooms. Around 1 a.m., someone called me. The lady I used to work for PPFN, she's late now. She was on their board from Bauchi State or Gombe State. Gombe State. She called me and said, it's a shame of the nation that these people arrive, they don't have money to pay for hotel. So I woke 1 a.m., I went to the reception, told them we will pay. I committed Pathfinder early in the morning to pay for their accommodation. Not only that, we paid $600 for each of them to participate. They followed me to my office. I justified why we must pay. We paid. Where I'm going is this, which is why I asked that question, what do we need to do differently? When it was time for me to make my presentation, I was on the high table. It was the biggest plenary session, big hall with over 2,000 people. We were there, and I was so proud that my Nigerian people, parliamentarians, were present. So when it was my turn, I stood and I said, yes, and I'm happy today to announce to you that Nigerian parliamentarians are here. And I say, recognize yourself. Nobody stood up. Nobody stood up. Earlier on in the morning, they had collected money from me. And I was to learn later on that, what do you call it, Jerome Mafeni had paid something. I was to learn later on that another UN group has also paid them. But no one was available. Parliamentarians stand up, they were Ugandans and others that stood up. I made my presentation and I was looking for them. One has gone to the US, one has gone to UK and all that. So what did they come to do overnight? I'm not trying to discourage you. I'm trying to tell you what we've done. The other thing was, Moji is part of it. I came with a copy. When Professor Shotimei became the minister, the first thing we advised him was that let's find out where we are today. Why are we in such a bad state? And so we invited people from all over the country. When I say people, future search. We picked somebody from the pension board who has been sleeping outside, sleeping in the open. We took him to Nike Lake Hotel, Protea. We gave him a room. The same room I had is the same room he had. Steve Zebudaya, Mochi, Nollywood, AGK, Asegu, name it, professors, different people. And then we had 2 emirs and 3 traditional rulers, other 3 traditional rulers. They were supposed to go back after opening ceremony. But when they had the content, they removed their garb and became participants for 3 days. Their pictures are here. That is how we developed the first National Strategic Development Plan. If anybody from the ministry is here, that is the background. We had different streams, one for media, one for different groups. The traditional rulers had theirs. They had role play. I brought a copy. You can pass it through so that don't start reading, but just pass it so you see the product that came out. As a result of that, we developed that strategic plan. We are in the second, who's from the Ministry of Health here? Yeah? They are not here. Did we invite them? You see, they are too big. That's the problem. They always come and they go. Are you one of them? Don't hide. You were part of the problem before you retired, right? So what I'm telling you is, no, you can pass this one, but please let it come back. let it come back. We developed that. It was working. Following that, we had the National Health Bill. At the time, 10 years it was in the House. Why? Because health is not regarded. If it was petroleum bill, it goes. It was banking bill, it goes because there are people to fund it. Nobody was willing to fund health. So we fought. And I remember Professor Ladipo is not here. I always talk about him. We had a meeting at the Sheraton where John Fashanu, who used to be a player in London, for those of you who follow football, was there. He was brought in. And we were like, what do we do? My recommendation was, can we just bring pregnant women to let's take them to National Assembly. And Professor Ladipo said, Mike, you will kill people. Let us not do that. But we did not stop. God bless my brother. I'm sorry. We met in my office and I said, Ben, we need to do something different. We cannot, I said it's not acceptable for us to continue the way we are. And that's how we set up the meeting. Then it was past 2. Dr. Isa is there, he was one. Gafar was in our Kaduna office. I took permission from the head of district. I said, we need to do something different. We need to match. And I took permission. I said, on so day, we're going to do it. That assembly had just 2 days to finish. It was on a Wednesday. I said, we need to do something different. I approached the market women. They said, how many? I said, give me 1,000. I said, if you want 5,000, I will pay. Overnight, they mobilized over 5,000 women. Name it. National Council of Women's Society, Federation of Women Lawyers, Form 1, all of them. I thought it was like a joke. By 6 a.m., Eagle Square was already packed out. By 6 a.m. Some of my, because I told Diffie, I said, if you hear my voice tomorrow, it is not Mike Ebo, the leader of Past 2 talking. It's Mike Ebo, the Nigerian, talking. Moji is here. I had more than 5 TV interviews. CNN showed it as breaking news. We marched on the National Assembly. I was the only person, some other people chipping out. By the time we got to the assembly floor, if I was arrested first by 4 SSS men that said it's illegal. I said, well, just carry me, no problem. But when I explained to them, they said, okay, give me assurance that they will not destroy anything on the floor. I said, these women are innocent, they can't. But they were not innocent. But they did not also destroy anything. And I think the Assistant Commissioner of Police who came to try to block us will forever remember and forever, he's learned a lesson never to look at women and think they don't know what they are doing. Because she was illegal. We were trying to pass through the gate. This is illegal. Stop. And all those things. And this is illegal. Stop them. And one woman just raised voice saying, Women, market women, oh yeah. And they say, oh yeah, move. The man was on the floor. A commissioner was on the floor being trampled upon. The long and short of it is that God bless Dr. What's his name? Not that, what's his name? Who died in Jos. He was there, Yabo was there, and the rest is story. Because when Yabo was preaching and said, no, you guys don't have to do this, the market woman said, if you don't pass this bill by tomorrow, on Friday, we will all come back here naked. And he asked all the women, are you ready to be naked on Friday? Everybody said yes. The long and short of it is that the bill was passed the next day. Even though David Mark was saying they were not passing it because some people came to make noise. He should not have passed it, but it was passed. Where I'm going is, as a result of that, finally, I don't want to tell you the story, which is what, again, I will share, because some of us have to go behind the scene to meet political leaders, to tell them to do what they need to do, including meeting Obasanjo. I met Obasanjo at 1 a.m. in Abeokuta. The meeting was supposed to be 9 a.m. in Ota. By 11 o'clock, I was told to come to Abeokuta. 11 p.m., not a.m. For those of you who know that road will know what it was to travel from Ota to Abeokuta at 11 in the night and to have meeting with you. You know, so I'm telling you these stories so that you know how far people have gone, you know, where the journey so far to this point. That said, the question I need to ask, what is our overall goal for this? The second is, what is the content when we say manifesto? How do we change the people who are putting these manifestos in their hands? How? It's not everybody that know how to eat ice cream. Neither is it everybody that know how to eat salad. They say if you give Igbo man salad, they will say this one, they never done. Not people like Francis. So what I'm saying here is we have to look at the content. We must write justification. What is the justification for this manifesto? Why are we writing that manifesto for them? How do we hope to convert those persons to be advocates for health? That is critical. Because Fela say you take music to deaf and dumb. What do? You miss road. The dumb can't see. The deaf can't hear. But the question is, how do we isolate those persons within the political class to put this in their hands? They may not be the politicians, but they may be gatekeepers for politicians. Every political leader in this country have backgrounds, have godmothers, have godfathers. And we use that a lot when we were campaigning for the health bill. We use that a lot. We were told who to meet. Some people went to see the Chief Justice. Some went to see the Minister for Finance. We met different people. When we were trying to do something in Lagos, we were told to see Tinubu's daughter. Even though I wasn't ready, I don't like her as an individual. But because of what we wanted, she was now the Yaologia of Lagos, a young girl. By the time we got to her place, I can't tell you what I saw. But I had to, because of the nation, bend my head, and I tolerated what I would never have tolerated in my life. Yes, so when you want to do something, you may need to go to the lion's den in order for you to get things done. Are we ready to do that? We should not put this manifesto in very cheap political hands and we think we've done something. We must be ready to break the trade. All the traditional leaders must be involved in this. Traditional leaders religious leaders must be involved. They must be convinced that this is something. You know, when COVID came, COVID did not recognize class. It was a leveler. It was a leveler. I was in the US and I saw doctors die, saw nurses die. In one day, Massachusetts General Hospital, 650 health workers were infected, just in one day. So the question is, when we're writing justification for this, for ourselves, so that we even know why we're doing what we're doing, let's think about Ebola. Let's think about Lassa fever. Let's think about COVID. It's a shame because when I joined public health, Nigeria had a vaccine manufacturing lab in Yaba. We had, I don't know whether you are aware, Dr. Nasidi was just a young man from Russia. He was there. As you're entering Unilag, the lab was on the left-hand side. Some people left Nigeria to go and train persons in Senegal and Gambia. In Gambia and Senegal, they have lab we don't have. And that's why I said, what are we going to do differently? We must ask that question. Otherwise, we just write the document, we put it in the hands of somebody, they look at it and they put it down. If it's not going to bring money, it will not make sense. In Lagos, we try to bridge the gap between the public and private sector. We brought in a Bank of Industry, Diamond Bank, and some other banks. We brought them together with government. We say, how can we fund private sector providers? What were the banks saying? Dr. Issa is here. They say they don't have system in place. They are high risk. They won't pay back. And when they make money, they go and buy cars. They don't have bank accounts. They don't have, there are so many things they listed. And so we started bridging the gap. We asked the government, can you guarantee that these people will pay back? Can we train them to put system in place? I'm saying this so that we understand what we need to do. What we are doing is good, but it's a daunting task. We must be ready to penetrate the political class. We must be ready to go to, even if you have to talk to IPOB leadership, we need to talk to them. And I'm not joking. If you need to talk to OPC in the West, talk to them. If we need to talk to the, even if it's Boko Haram, talk to them. It's not too much. They are easier to deal with. The elders, I have conducted a workshop where we invited El Zazaki. That time there was no problem. All the other Islamic leaders, the Arewa House, they say if he's coming, they will not come. But immediately the man entered, everybody stayed. And he contributed the best. So I'm saying this to mean that we need to confront. It shouldn't be an easy thing. It is not something my brother, Dr. Abu Wahab, is working with governor. He knows what I'm talking about. He's been out on the field. So we need to look at all those justifications. When we have developed this document, how do we disseminate it? And to who? Through what means? How do we disseminate it? To who? What we did during Goodluck Jonathan's time was that we penetrated every political party. We were non-partisan. Every political party. We penetrated them and made sure that they put it. That's why under Goodluck Jonathan, health was, I think, number 7 or number 5 on their 9-point agenda. That's the first time health will make it. So this, we can make it here. But we must be ready, we must develop strategy for disseminating it, making sure that every person that needs to hear, yes, you know, because like those traditional leaders that came to Enugu, they say we never thought we had anything to do with health. We actually just thought it was the commissioners of health problems. Religious persons, the same thing. So we must develop, this should not be a one-off thing. This must not be a one-off thing, otherwise we're wasting time. So we have to develop that dissemination strategy. And then who do we deliver them to? Who among us will deliver it? Who are those people who advocacy champions that we will bring in that will help get the message out? Because you need, like the Sultan of Sokoto should be one. When he gets into his hand, he will call not only the governor of Sokoto State, he can call the Senate president and say, look, what are we doing with health? Our people should not be dying this way. So when you have pressures from different angles, then you start to see answers. I think finally, during election and post-election, what are we going to do? We put it in their hands. What are we going to tell people to make sure that people vote for those persons that have this manifesto? Because we have to also have carrots in our hands to say, oh, women will not vote for you, or youth will not vote for you. If we let youths know that if they die young, they will not have a place, they will look for what to vote for. We'll start to see those manifestos. So we must identify that one. And then during implementation, let's assume we now win. Health is on the agenda. How do we monitor it? Health Act is there. We had to fight to get money into the Health Act. Everything that we're supposed to do under the Health Act have not been done. How do we monitor it? You know, so we have to say, what structure do we put in place to monitor the accountability? We talked about accountability framework. How do we hold people accountable for their stewardship? Those are the things that we should be developing. So it's not just the manifesto. And I said, I will end by saying again, manifesto without manifestation is equals to zero. Thank you.
I think Oga Mike deserves a stronger round of applause. It's always very, very exciting listening to Oga Mike because of his wealth of experience. Honestly, those of us that passed through his tutelage were highly blessed because this is the dose of instruction and advice that we get every now and then. Somebody says, one of the important reasons why you have to listen to people that are in the business for long is one, to know how to do things, what to do, and two, to know what not to do. At the same time, if you have to make a mistake, make sure you are only making a new mistake. So that is the essence of having that. So Oga Mike, we really appreciate. Thank you very much for the encouragement. Thanks for telling us what works and what we should pay attention to so that this manifesto will manifest. I will not become another document on the shelves. Before you came, we said that our shelf is filled already. There's no space to add additional document. What we want to add is additional action. So that we'll get results. So thank you very much. And I'm glad to tell you that some of what you said, we are taking them into consideration already in terms of a dissemination plan when we develop this. Who needs to have it? And it's not only a matter of presenting a document to them. I want specific action from them. And we are trying to, and that is why we're here, to map out what we need to do before the election, during the election, and after the election as well, so that the whole big picture of putting health on political front burner will be actualized. So once again, thank you very much, Oga Mike. Our time is fast spent. I think we quickly take the presentation from the three groups. Then we have a plenary conversation because the time is fast spent. Then we close. I know, please come and take over. So I think we have Madam Vivian and Dr. Yakasai to moderate the presentation section. Okay. I hope you have collated all the presentations. And I'm very sure Gamaik will stay behind to listen to the presentation.
Hello. Sorry, the online people. So where we are trying to put on the online presentation on the slide. Online, can we please have Dr. Lecky? Can we have the online participant salary being shown, please? Yeah, it's still online. Okay. Thank you, everyone. We can see you all. We have Dr. Lecky, we have Marian, Judith, Peter, Osaji, Faith, Alfred, Nata, everyone online. We really appreciate it. Dr. Lecky, we can all hear you now. We know we saw your hand up initially. We are still happy to have you now, so we can hear you quickly, sir.
No, my hands have seen now, and I participated in my group work. So we have a coordinator who will present our report if he hasn't. I think the point I wanted to make, I've made my comments on the chat, if you can read them. I endorse a lot of the things that Mike, said, a bit windy. I think the important thing is that we are really not doing anything new. Each time there's a new administration coming, it is proper, whether or not we are restating the obvious, that we restate the obvious, because not much has been done with the past. So what we are doing now on the eve of a new administration is clearly welcome and in order, so that we can reset, going forward. And I think the overriding concern is to address the issue to make sure nobody is left behind in terms of access to healthcare services. And so very many people are left behind.
Hello. Pardon? Thank you very much for that comment. And I think we would like to rush this part because we have people online that will be presenting, and at the same time, people offline or on the ground that will be presenting. So we would like to start with the online group, group 1 on the online, on universal health coverage progress. So who is presenting for group 1 from the outer space? Group 1, we are listening to you online. So the group 1 online is now physically offline. So you're welcome. A round of applause, please.
Okay, thank you very much, sir. Good afternoon, everyone. So I'll be presenting what Group 1 came up with online. So we worked on results areas 1 and 2, and also on intervention areas 1 and 2. So for the first result area, universal health coverage, we worked with the listed indicators. We have the health insurance coverage, out-of-pocket health expenditure, and also access to healthcare services. So for group one, we tried to think through the baseline first to establish the baseline so that we can use that to find our targets. And for the baseline for health insurance coverage, we put not available. If we check the footnotes there, okay, so for the not available, we know that NHIS says, like according to NHIS data, we say less than 5% of Nigerians are currently covered by any form of health insurance. But we also acknowledge the fact that now we have state social health insurance schemes across different states, and they've covered some certain percentage of population within the state. So that 5%, less than 5%, may not be very accurate any longer. But so we put not available, hoping that we'll be able to harmonize that data and establish that baseline before we finalize the health manifesto. And for the target, we're looking at a 5% yearly progression target. So by 2027, we have 30 to 35% population coverage. And at least by 2027, at least between 30 to 35% of Nigerians should be covered under a social health insurance scheme. Then for the out-of-pocket health expenditure, we know that according to the 2017 National Health Account, 70% of total health expenditure comes from out-of-pocket spending. So we put a target of 50% that should have reduced to at least 50% by 2027. And for access to healthcare services, we also could not establish a baseline, but we believe that the NPHCA should be able to provide some of that data. And our target is just to have improved access to healthcare for all population groups, from vulnerable population to other population groups in Nigeria. Then for primary healthcare, we work with immunization coverage, skilled birth attendance, maternal mortality rate, and under 5 mortality rate. And we also established the baselines using existing data, mostly from the NDHS 2018. So for immunization coverage that is currently between 75 to 80%, that by 2027, we should have at least 90% immunization coverage for all basic immunizations. And also, skilled birth attendance is currently 43%, and we are looking that by 2027, that should have increased to at least 60%. And for the maternal mortality rate that is currently 512 deaths per 100,000 live births, we are hoping that would have reduced to 350 per 100,000 live births. And I think we skipped making a target for the under 5 mortality rates. We're suffering some network challenges. So for the policy interventions, we worked on the policy interventions 1 and 2. The first one being the resource optimization, policy and resource optimization, and the second one, strategic investment and sustainable financing. So some of the policy interventions that we articulated for the resource optimization are to advocate for full and timely releases of health budget allocations. We know that yearly, even though we don't have up to the 15% Abuja declaration, but we still find out that every year the full amount is not released completely. Sometimes we hear that money is being returned to the treasury. So we want to eliminate all of this, that even the little amounts that we have, we are able to use them judiciously and completely. So advocacy for full and timely releases of health budget allocation, then capacity building of all health program managers and policymakers on also the effective and timely utilization of donor funds and also government budgets. And in local resource mobilization, tracking, and also investment in health, we said that the CSO, civil society, and media should, and media, including other critical stakeholders, should be more involved in resource tracking and mobilization. Then for sustainable investment, sustainable financing and strategic investment, some of the policy interventions we have is to publish biannual scorecards or appraisal to showcase performance. I think we can all agree that sometimes it's very difficult to get health expenditure data, especially during the fiscal year. Most times you're able to get it in the following year, maybe even middle of the following year. So being able to have real-time data, which will also aid advocacy, is very important. Then also to create an accountability framework to track effective utilization of not just government funding now, but also donor funding to reduce bottlenecks and also reward MDAs for performance so that they can be encouraged to perform better. And we also have the advocacy for full and timely releases of health budget allocations here, because it also seems to apply, and to set up national and subnational oversight committees to track health budget implementation. Thank you very much.
Thank you very much. Another round of applause, please. If you notice, we are going to have 22 presentations. So you have an announcement to make? All right, so those who are on the ground, group 1, are they around? I think to make things easy, we'll take all the presentations and then do discussions later. It's already 3 p.m. and we have 11 groups to present. Online. Okay, no, not 11, 5. Group 1, where is group 1? Are you hiding? Not online, no, offline. Group 1, I saw them sitting somewhere. Anu. Oh, excuse me, sir. Where is sir? Are you not group 1? Group 1. No, this is online. In-house. So group 1, you don't have a presenter. Please, anybody from group 1, let me see your hand so that please give her a round of applause so that that will strengthen her legs and her hand and her mouth. All right.
Okay, hello everyone. For the universal health coverage progress. Okay, that's the result area. So the indicator for health insurance coverage, it was assumed that the baseline has an increase of 7%, and by 2027, it should have increased to the percentage of 60%. So, and for out-of-pocket expenditure, the baseline percentage is on 10% per annum. So by 2027, it is assumed to have increased to meet a target of 40%. So some additional indicators were added, and that's for percentage of annual budget allocation and expenditure to the health sector. We have a baseline of 5%, and we are expected to hit a target of 15% by 2027. For domestic health government expenditure, we are on a baseline of 4.8%, and to hit a target of 15% by 2027. Also, under the universal health coverage progress, there's another indicator of domestic health government expenditure with a baseline of 4.8% and a target of 15% by 2027. Also, counterpart funding for basic health care provision. Well, there's no stipulated baseline percentage for that. So, probably based on historical data, so we assume to reach a percentage of 25% annually. So when accumulated together, we can do the calculations. By 2027, we should reach a particular percentage, but per annum, we should have a 25% percentage of counterpart funding for basic health care provisions. Moving down to primary health care. Under immunization coverage, the baseline, we have 71% baseline, and it's assumed to reach 80% by 2027. Also, another indicator for primary health care is functional primary health care center political world. Well, there's no speculated percentage for the baseline, but by 2027, it is assumed to have reached to have a total number of 10,000 healthcare facility in a particular ward. Also, skilled bed attendance. We have a 67% of baseline and assumed to reach 80% by 2027. We were unable to ascertain specific percentage for underweight, maternal mortality, and under maternal ratio, but we will do the calculations in the background.
Excuse me, what's that on the screen? I don't like that.
Like, scroll down. The strategy shifts.
Excuse me, what was
Okay,
that?
for the policy resource optimization, okay. We have an intervention that we should have a
Yo, I'm not gonna
fundamental
lie,
state
Shorty
health
trying to bad. She kind of
agency.
bad though. I might have to clap them cheeks. Yo, she like African
Yeah, a
food.
functional state
Might give her this
health
big ass
insurance
dick,
agency,
that big ass black
and
African dick
also
though.
have a
I'ma dick
functional
that bitch down. That bitch keep
primary,
dirty or
Yo,
she
Matt,
eat
hold up,
Snickers
bro.
bar.
Hold up, bro.
yeah,
Fuck
primary
this nigga, yo, on phone
health
on. Fuck
care
this shit.
facility per ward.
Fuck council, nigga. On God, fuck y'all
Okay.
niggas.
The second one,
Yo, that's the
we
African
reach
Council,
an
bro.
intervention that
You're not.
review of National Health Acts,
We're leaving like 6
including the
minutes.
basic health care provisions, and also enhanced primary sector engagement, private sector engagement. Thank you.
That club was not encouraging at all. A big round of applause. All right, my colleague, please jot down all your comments, questions, and I will take them at the end. Thank you. My colleague will introduce the next group.
Yeah, I have a question.
Sorry. Okay, we're ready to do
I have a
group 2,
question.
online first, and sorry about that. Okay, so we're going to do group 2 offline. So demographic
question.
evidence and
I have a question.
higher level of care. Group 2.
I'm not gonna hold you. Shorty kind of bad though. Damn, that's a little light skinned John. That's like a little ebony John.
Matt, no way we're fucking crashing an African Council meeting, bro.
Bro, I
This shit
swear to
looks
God,
so
I crashed
organized.
court. Bro, I swear to God, I crashed 2 court cases yesterday, bro.
Yeah, that's a council, bro. You can't be playing like that. That shit, they have professional cameras. You can see that.
Hey, everyone in this council, fuck y'all niggas. I live in El Paso, Texas. Come here, nigga.
What is this interference noise?
So good afternoon, everyone. So I'll be presenting for group 2. We worked on 2 resource areas. The
Excuse me, I
demographic
have a question,
dividend
madam. I have a
and
question.
higher level of care. So under demographic dividend, we worked on
Miss, I have a question.
modern contraceptive prevalence rate.
I have a question.
And the current modern contraceptive prevalence rate is 13%.
Yo, I have a question.
So we would like to go
I think this Zoom has been hacked. Please.
No, I have a question.
So for the
Who are
country to
you?
have to reach up to
Oh, my name is Wayne Lin. I'm from
more than
Nigeria. Miboda.
contraceptive
I'm here
prevalence
for the
rate
meeting.
by
Miboda.
2027.
I
So
come
the
in
target to
peace.
start
I come in
running from
peace.
now. Then for
Miboda, why
medical
you mute me? I'm
tourism,
here for meeting.
for higher level of care, we looked at
You have
Matt,
volume
stay
of
muted for a little
medical
bit.
tourism and the number of comprehensive cancer care centers that we have in Nigeria. So for medical tourism, so currently the volume of medical tourism is estimated at about 1 billion naira per annum. $1 billion per annum. that was a mistake. So it actually ranges from $400 million to $2 billion, but this is just the average. So we feel the target should reduce this volume by 50% by the end of 2027. And this will be done through public-private partnerships, improving the medical manpower training, then boosting clients' confidence on the country's health system so that they don't need to be moving around to get medical care. Then we also looked at the number of comprehensive cancer care centers now. Right now, we have 9 comprehensive cancer care centers spread around Nigeria. So we have them in teaching hospitals. Then in Lagos, we have the NSAIA youth partnership. So the target we are setting is to have 1 cancer care center per state by the end of 2027. It sounds quite ambitious. It's quite ambitious because of the volume of resources required to get this done, but it's a target that can be met if the government is really interested in doing this. So then we also want to improve the functionality of the existing cancer care center. That's one we feel is something that the government can actually achieve. If we have all the 9 cancer care comprehensive cancer care centers working properly, we may not need, people may not really need to be traveling abroad to seek medical care. Then we also, for cancer screening programs, government needs to also increase the funding for cancer care screening program, and it should also be, it should be more comprehensive at the primary healthcare center level, because in the group, we discussed that the WHO estimated the number of cancer centers that Nigeria requires based on our population to be about 250. And now we don't have anything close to that. So we should focus on making the primary healthcare centers to be able to conduct simple cancer screening at that level. Then we also discussed how equipment really gets spoiled after some time of use. So government needs to reach a long-term service agreement with the companies supplying this equipment so that they can support in terms of training and also after-sale maintenance for a long time. And the service agreement should actually be quite long, not that after supplying, then they leave everything to us and the equipment gets spoiled. So that is what we did for this, this first section. Then for the second one, the strategic interventions. So we worked on raising the accountability bar for health systems. So we talked about 2 policies. So the first one is to establish a legislation that will mandate all MDAs to publish information on resource utilization, policy implementation, and system performance. They need to make this information public. Then under system performance, we need information on finance and service provision. So we feel that if all these MDAs, if MDAs are left to just publish whatever they feel like, they may never publish anything because nobody really wants someone to come and probe what he's doing in his agency. But if there's a legislation backing this and they know that they have to do this by law, so they will be able to do this, and transparency is the first step in accountability. So when this is done, we're able to hold them accountable for what they are doing well and also commend them for what they are doing well and hold them accountable for what they are not doing well. Then establishing an independent monitoring board composed of stakeholders from the CSOs, private sector, media, and the government itself. Then we think the board should be private sector driven, and the purpose of the board should be to track performance at all levels, from primary healthcare level, secondary to tertiary, and also at all levels of government, from local government, state, and federal government. Then this board should also be saddled with the responsibility of tracking what the political class has promised, every service what they have implemented. So we need to be sure that whatever they pledge that they are going to do is actually done, and we will hold them accountable for these pledges. Then the next one that we talked about is the citizen engagement. So under citizen engagement, we know that the citizens from our discussion, we feel that the citizens should also know what is going on in their domain. They should know what policies are in place. So to ensure that this is done, then citizens' engagement needs to be integrated in policies right from the policy development stage. They need to know why these policies are being developed, what problems are the policies solving, and how are the policies going to be implemented, and their roles in implementing these policies. Then we also discussed citizens' enlightenment. Realize that a lot of times when we say, okay, we want to set up some organs of some structures within the community to hold the political class accountable, sometimes when we select or elect them, they still betray the community members. So this time we feel things should be more transparent than they really are now. It should not just, for instance, information on what is happening at the health center should not only end with the WDC. The community themselves should know, because sometimes these WDC members that we're talking about even connive with people at the health center to do some runs, so to speak. So we need the community members to be aware of all the interventions that are going to be implemented within their community. They need to know the details of the interventions, the importance of implementing those interventions, the resources that have been released to implement the interventions. And we feel that this can be done through the CSOs, the CBOs, and even the faith-based organizations within the community, so that they are aware of what is happening, they know what to hold the government accountable for. And if someone is deceiving them, they know exactly what to expect and they know what to do to hold them accountable. Thank you very much.
Thank you, Kafayat. I think we have one more, which is health security. I hope we're all noting down our various questions for the different groups, that we have a quick plenary session afterwards. Okay.
So for group 3, we discussed two results areas, namely health security and another which we identified as nutrition. So the indicators that we talked about for health security, it's one specific indicator, and this is the Joint External Evaluation Score. This is a composite score measuring health security preparedness. And the target we set is at least 60%. So I believe this is at least 60% of the score identifying which indicators show that the health security is at a level that it should be. So at least 60% of those indicators. And the timeline that we set is, the target is 2027 for both areas. The next area, which is nutrition, the indicators that we discussed were prevalence of anemia among pregnant women. And from the existing data, we identified the baseline as 56% as of 2019. And the goal is to get this to less than 30% of pregnant women being anemic in the year 2027. Our next indicator is the percent of children under 5 who are stunted. At baseline, we have 43.6% as of 2017, and the goal is to reduce this to less than 20% of children under 5 being stunted in the year 2027. So for strategic shifts, we discussed the first, could you scroll the title of number 5? Okay, we discussed strengthening the capacity of health institutions at all levels. For this area, we talked about a number of interventions. I'll start with the one that we identified as being both technically sound and politically attractive. And this is the last bullet, which is to enforce the certificates of standards provision in the National Health Act. So we found this as the most attractive bullet, attractive intervention, because a legal framework for this already exists. And when it's implemented, it can help to better the health system by making facilities more self-sustaining through improved performance. The other interventions we discussed under this strategic shift are corporate repositioning through corporate planning. And this can be done through mandating clarification of roles, appropriate definition of functions of different roles, provision of needed tools for these roles to be carried out effectively, and having a clear linkage between reward and performance. The other intervention we talked about is institutionalizing annual state of health reports at all levels of governance. So this is federal, state, and so on. And the next intervention we talked about is having compulsory leadership and management training for key roles within key institutions. The next shift we discussed was multi-sectoral collaboration. We had a lot of brainstorming here, but what we came up with in a nutshell is promoting this type of collaboration by having all sectors involved in the review of health policies that are proposed. So in specifically having representatives of other health sectors look into these reforms and see what roles that they can play in the implementation of these reforms. Thank you.
Okay, we are trying to get through. How much longer do we have? We have time for maybe for each group 2 questions, or we wind up. Have any questions, or things anyone wants to raise? My leader. Notice I called her my leader. She knows the name. I wasn't here for the remaining part of the presentation, but at least the one I had, I would like us to try and shift from the technical to technical. Everything is done in school, but it's very technical. And coming from a political background, they may not understand. So I cannot think of the right way to look better at what is done. It's technically sound, but politically not wise. So I must have an incentive to want to do something. If I don't have an incentive, I don't want to do it. I hope we are flowing. Particularly the last one. It's too technical. It's too technical. Honorable Usman will tell you, give him something that make him respect. Oh, this thing is good idea. But that all those things, let us go home.
But we
Thank you very much. Let me start generally by commending the whole team for doing a very wonderful job. Secondly, writing on what my sister mentioned, I think she's right. You see, we politicians, really, there are certain things we're looking for. And if you give me a document, if I don't see them, honestly, I will just vote. So we need to be specific, come down the earth, mention things that are doable, that are measurable, that you can really show and demonstrate. Else, wasting time. Secondly, even the targets, some are too ambitious. I wish, for instance, the timeline would have been from, because the gubernatorial, the presidential, I'm with, for instance, attached to a gubernatorial candidate in my state, Kaduna State. While at the federal level, I'm sure I'm going to be in the campaign team of whoever is going to be the president. The agenda we're going to come up with is going to be an 8-year period, because the assumption is that anybody who comes says, we want to do second term. And denying, it's very difficult, no matter sometimes the poor performance. So if it is 8-year period, then even this can be segregated. So that after 4 years, what have you been able to achieve? Set up a target. For instance, let me give you an example. On the budget, and I saw it, 15% it's not a reliable, realizable target. It's very good, yes. We all talk about Abuja declaration, whatever. In fact, when I was in the house for 4 years, I know the struggle just to hit the baseline of 7.5% at the federal government level. But we couldn't really achieve, in spite of the fact that Senate President, we were together, we worked together with Senator Toju. It wasn't really possible. So these are things, practical things, which, from there, assuming, for instance, now say in 2017, 7.5% hitting the baseline, because now we are at 5%, really. It's a doable thing. Then after the next 4 years, then you take it, even if it's another 2.5%, making it 10%. If Nigeria is able to achieve it within the next 8 years after the election, that would be very great and fantastic. So let's simplify this. Lastly, we should have two different agenda. When we go into the state, it should be different from that of the national level. I recall in the summit, I did mention this. The governor who is, they have different targets, they have different things, So federal government level, yes, health is on the concordance, but, PSC, for instance, development, whatever, is at the state level, really. Even though federal government through the basic care provision fund is really given the resources and what have you. So these are just my contribution. But again, part of what we can do is, because time is not on our side, you can set up a small committee of about 5 technical people to further refine this, articulate this in a very perfect manner. Thank you.
Okay, thank you very much. And I think I'll just write on what the 2 previous speakers. Actually, I was, as the presentations were being made, I was actually taking the key points, which we now need to convert into political messages. And I think that is what, from most of the technical things that they presented, we're able to tease out things, which you maybe not a politician like my big brother here, but at least you have to put yourself in that position that you're trying to convince the electorate what kind of message you have. And And so from the presentation of the three groups, we have a couple of things that are politically sellable. First, the issue of health insurance. So you have the issue of trying to make sure that as a politician, what you're promising is that there's going to be mandatory health insurance, that you can just walk into a hospital and then you're going to be able to access care. So I think that one, just get the messaging right, is one good thing that we can have. Then the second thing, the issue of primary health care, that when you say you want to have one functional primary health care per ward, people can relate to that, that you want to have a functional PHC. And then maybe adding to that, I think there has been a support to say you should have a general hospital, one per local government. So when you put those two agenda, it's something that's politically sellable, and it's something that's an intervention that can yield a positive result. So I think that is another intervention that you can push. And very close to it, I think the one that our group worked on, the issue of certificate of standard. The issue of certificate of standard is something that is also politically sellable. Because what you are telling the electorate is no hospital, no facility is going to operate that if it doesn't meet certain minimum standard. And that any facility that does not meet that, you're going to close, but that you're going to strive. So whether you're going to have one PHC per ward, so you can actually link them together. Having one PHC per ward is not just going to have one PHC per ward for just for having that number, but actually you marry it with the issue of the certificate of standard. There is issue of modern contraception. That is an important issue, but you have to message it in terms of, it's not that you're going to reduce the way we put it in the presentation, but rather I think for those, we're trying to promote it that you're going to make sure that people have access to this modern contraception, that they don't have to suffer, they don't have to go through lots of stress. Maybe if you now look at the data of unmet needs of contraception that's very high, it will help you to craft a very good message around that. Then one thing that's also we mentioned is the issue of medical tourism. Medical tourism is something that people can relate with. But then when you link the issue of certificate of standards, have an issue of PHC facilities, so general hospital, you can be able to link it that you now have functional facilities and people don't have to go outside the state or the country to get standard facilities. So maybe you have to look those ones, you have to link that together. But at the end of the day, ultimately what we're saying is we're going to have quality facilities and people don't have to travel. And so you have to, if you are talking at the national level, you can say you have, when we say cancer center, one per local, one per state, that one is over here. Maybe what we want to do is in each of the senatorial, in each of the, what do you call it, geopolitical zone, we could have certain specialist services in each of the zones. So as a national person, you could promise that. When you are at the state, you have to reduce it within the context of local government. Then people talk about, yeah, cancer is something that is really very sensitive. Also, in terms of messaging, medical tourism, I think we should also look at our data and say, what is the commonest cause of medical tourism? And what we want to do to be able to address that issue of medical tourism. Then we'll talk about issue of equipment. You have to find a way of messaging it. And then issue of accountability. I think for politicians trying to say we're going to create, now is you have to put yourself in the position of a politician. I don't think a politician would say, I'm opening my eyes for you to go and put it. At least you have to look at things that would be, that he is also very confident to say, look, whatever I do, I'm going to invite CSOs. I'm going to give you access to data. I'm going to be presenting to you every quarter on certain things I do. So that you outline that one, so that it will create a platform for accountability. So what I'm saying is all the things we have discussed that people are talking technical, so we now have to change it. That maybe because I'm sitting very close to a big brother here, I'm also trying to learn how to talk politically. Thank you.
He will summarize everything. Thank you very much. I just want to suggest to the organizers that I'm sure, but before we came here, nobody knew that they are going to ask them for statistics. That many of the figures that have been produced perhaps need to be checked again to make sure that they are the correct figures. And then when we talk about under 5, I'm not sure the country has ever set any targets. We've always been working back from what it was before and how we have improved it, rather than looking at where we want to be. It has never been that. So the SDG 2030 has targets that they expect every country to reach. So I think we can latch on that. And for under 5, every country is supposed to reach at least 25 per 1,000 lifeguards by 2030. Right now we are at 132. Then for maternal mortality, every country is supposed to reach at least 70 per 1,000 lives. We are still about 560 something, so it's a far distance. Then the immunization, what we saw there was about 71%, and then they said the target is 80. It will be as if we are very close. No, that 71 you have put is just the Penta 3. Whereas the 80 is to get herd immunity, and that includes every other thing together with measles vaccine together. And when you combine it, what we are in the country now may not even be up to 40%. So we should put all these things properly together. Then in line with what most people have just said, when we talk about 25 under 5 people, under 5 children dying 25 per 1,000, the ordinary politician or even ordinary member of the public may not understand. We should work this out in terms of the real figures. How many children under 5 are we losing every year? So if we apply 25 per 1,000 times the Nigerian population, we know that those are in millions. So those are the figures that we should be discussing about, because most people may not be able to interpret what 25%, 25 per 1,000 live births mean. The same thing with under 5 and so on. And in line with what most other people have said, if we are losing so many children every year, and if we are losing so many mothers every year, what are the health implications? What are the social implications? What are the economic implications of the country? We should be able to digest it down to that level so that the politician will understand that if we don't want such thing to happen, these are the actions that need to be taken at a political level. Then in terms of medical tourism, what we saw there was not the volume, it was the value, because we didn't have data on the number of medical tourism going out every year. But we were able to get the figures in terms of dollars, which estimated it to be between 400 million to 2 billion as at 2021. And that is a very huge figure. So as we go forward, we should try again and use that figure to see what else it can do for us within the country. And then I personally disagreed with the suggestion that we should increase, we should put comprehensive cancer centers in every state of the country. No, right now we have one per zone, and then we have one in Abuja. The government is not even able to maintain them. So rather than thinking about adding more, it doesn't make any sense. But my own suggestion is that as much as there should be effort to improve the functionality of this, our emphasis should be more at the state and local government level in terms of screening. Let's put more emphasis at those lower for screening centers to ensure that early detection we achieve as much as possible across the different. And then in addition to screening programs, we should also be able to educate the masses, because many people still don't understand, even if we have screening programs, people still don't understand that they can be saved from certain conditions by just going for mere screening. So that screening procedure and then mass education is what I think we should emphasize more at state and local government and community levels. At the federal level, let them handle the few centers we have to make sure that they are functional. Thank you.
Thank you very much.
I hope you can see my voice. Okay. I think we are medicalizing this. You know, we're putting the cart before the horse. I forgot your name, sir. Honorable. Yeah, I know you very well. You know, there's a language you give to politicians. You can't take technicalities to them. It's like producing, you put a graph, you show graph and all those. They will leave you. You'll lose them. So we have to couch that language. I give you an example where I was on a team with the late IBB's wife and Professor Ladiko. We met, I think it was Senator Namani, who was the state president. The way we presented the case, it was like, okay, when an aircraft crashes carrying 190 people, we fly national flag half mast. And we said 66,000 women are dying every year. And that is how many aircraft load. Nobody is flying half mast. X number of children are dying of malaria, not flying flag half mast. X number of women are dying while giving birth. We're not flying half mast. So what is the reason for? Because one aircraft carrying 90 people crashes, but meanwhile in a day, X number of children are dying, X number of women are dying. You can also present to them, we resume here 9 o'clock. Between 9 o'clock and this time, X number of people have died. When we told Senator Naman like that, I said, is that true? He removed his agbada. I said, am I sitting here if this is happening? I'm just letting you know how it was the current governor of Kaduna State that was the speaker at that time. They were both there. It touched them. So we have to look at the language we're going to use. Why I said we're putting the cart before the horse is we first give them the language to convince them that they should be part of this fight. And then we can sit with them to work out the details. This is not the time where we will have to say we need X number of this. We're thinking as health providers. They don't hear our language, whether you like it or not. That was not what we did. We had printout, we had pamphlets that were printed out to show how many children are dying, to show the population of Nigeria in relation to other populations, to show how many women are dying in Nigeria, how much we're contributing to the world, and that if we don't do anything, ABC will happen. We can show that today we're still waiting, begging for nations to give us COVID vaccine. We're begging. Nigeria should not be begging. This morning, I almost cried when I heard Amechi saying, Nigeria, come and donate money for the victims of the Kaduna train bomb. Nigerians should come and donate money to help their treatment. A minister said that. I don't know whether you guys listen. It was on radio today. This is Nigeria, for instance. This is Nigeria providing technical aid to other countries, all the way to Jamaica. Sending people out to every country in Africa. Nigeria is rich enough to provide development to other African countries. So the question is, what are we going to do? So these are the kind of things. If we don't couch our language very well, we will lose it. And the moment you lose it, it's very difficult to regain it once they have gone into power. So this is the time that we need, which I said the honorable suggestion is very key. The language is important. The language, this is not where they are not asking us to talk technicalities, one this per word, one that per word. How many people understand national health insurance? How many people, even in the Ministry of Health, understand the National Health Act? Dr. Yema Kinde is here. He knew that he was there when I was fighting one minister. When somebody who did not qualify to be in this country was in this country talking to Nigerians. You remember her? I wrote a petition to WHO and to the minister. Finally, they kicked her out. But we must learn to stand. The language is very, very, very important. They are not asking us to come and write proposal. If you write proposal, you miss it. It's as simple as ABC. So let's work on the language. It must be simple. It must be easily digestible. It must be something that say, wow, I didn't know that. It's not our technical stuff. Thank you.
Thank you very much. Thank you, everyone. I would like to say that, I would like to say that the purpose for this workshop is multiple. One is that we all know that there are too many things to do in health. And if you want to do a manifesto, that is something that you can sell to the political party, is to reduce it to a minimum number that they can work with. And the essence of this workshop is to say, out of everything in health, what are the few things that we want to pick and give it to the political parties, the politicians, so that they can work with it. But of course, that is not all that is in the health sector that needs to be achieved. So this is just summarizing things that we who are here consider important, and we will give it to them that if you do this, the impact can be higher. Because some governors and some local government have invested in health, but if with a little advice, the investment would have had more cost benefit, more cost effectiveness, and more utility. So we are trying to say the little you are going to spend, if you spend it in this, you will have higher value. So this is what the workshop has achieved. Secondly, when you put an expert, you expect expertise. So the people here are experts in this area, and what they are producing are expert work. And the second part of the workshop, which we will do after, is to get the likes of Usman. Even though Takafar is a politician, he's just claiming that he's a technocrat. He's both a technocrat and a politician. We'll put them together and say, okay, these things that are accurate information, how do we rewrite it in the language that the politicians will understand? But the first step must be to get the correct information. And what we have done today is experts have produced correct information. The next thing is to rewrite it in the language that we want the politicians to understand. So I think we have achieved the first part, and all the advices on the second aspect is what Gafar and Timothy will take the lead on. And what we want is a computer, not how to write the software. So we have produced the software now. The next thing is Gafar and his team will produce a computer. So we'll see a beautiful projector and a beautiful computer that can relate to it. So we thank you very much for coming. And I want to give my colleague the opportunity to also say a word or two.
Thank you, Dr. Kasai. I think it's important that whilst we focus a lot on political leaders and what we put in the manifesto, we also know that at the end of the day, it's the voters who have to decide who they get, who elect. And one thing we noted in our group was citizen engagement. So in as much as we write these manifestos, I think there's a very important role in informing the public about health. Often we have politicians who build hospitals and say, we've done health for our citizens, but actually that's not what health is. So I think a lot of the work we all have to do with our different organizations is ensure that we also inform citizens about what good healthcare is, and also that they have a right to good healthcare. I think Nigerians are used to not getting any health at all, so it's not something they demand when they go to vote, but it's really elevating health for every Nigerian so that they know that, that child that died of diarrhea actually did not have to die. If your local health center was working adequately, if it was running water, all those things that we all take sometimes for granted that we think people know. So I think in as much as the manifestos we develop, let's also keep in mind engaging active citizens so that when they vote, they know why they're voting and they don't get waylaid by just looking at shiny new hospitals, which ultimately will not solve their very basic health needs. So unless there's anything further, anybody? Okay, Dr. Lecky, I think wants to say something final. And Mike, Ida, sorry. So just some final comments and then we close the session. Dr. Gafar?
Okay, thank you for recognizing me. I was just going to leverage on what Mike has said. Let's try to keep this simple. We're talking to politicians. The simpler we are, the better, so that there is no miscommunication or translation of what we mean. I also want to say that as part of this process, we should try to harvest some good practices. It's not all a lamentation of badness across the health, space. There are a few good things that are happening. So I don't claim to know all of them, but I'm sure in this kind of assembly, we can look into what is done at the local government or at the federal or state government level, some good, even at the agency level, and see how those things can be highlighted as worthy of support by a politician to scale. And one that actually comes to my mind is something that the NHIS launched sometime about 2 years ago, which is this group individual and family social health insurance program. I think that is a clear, good vehicle that can scale up UHC. So this sort of thing should be at the first burner, making sure that all politicians buy into and put their money, constituency project around that. If those of you don't understand it, please go and find it by the gift ship. And this is best practice. And I think it has the potential to actually advance both service provision, both coverage of the most people, and also affordability, which are the three tripods of UAC, which is the concern here. So keep the measures simple, harvest good practices, and scale them up. Thank you very much. I'm done.
You may speak now. You're muted.
Yes, just to also thanks Dr. Lecky for that part you shared. It's very important that there are some good practices that we can leverage and build on to encourage politicians to see what they have done that is adding value to ensuring the universal health coverage is attained. But again, in all our discussions, let's also not forget in all our thoughts to ensure health coverage for all, that persons with disabilities and those with mental health are also not neglected. There are a couple of groups, if we are not factoring them into this plan, that could be forgotten. The whole idea is that let's not leave anyone behind. Thank you.
Dr. Lecky, you're a black cunt.
Thank you. Thank you very much. No audio, we're not hearing.
I think we're being hacked somehow.
Yes, we were. Somebody said we're not. We're being interrupted, clearly. Okay, we will be back on stream. Let's manage on.
Whatever is said, we'll give it to Gafar. He will look for those who know how to translate it to political language. That is the next thing, Dr. Gafar. Thank you.
So thank you very much, Dr. Ekasai. Because our time is fast spent, our sugar level is very, very low. I think we have to close as soon as possible. But if you agree with me, I think we've accomplished. I think we've covered some grounds in terms of what we want to achieve, and I thank all of you for the contribution. But before we go, the representative of our two leading political parties in Nigeria are here. We just want to give them a couple of minutes each to tell us, okay, what is their perspective on this, and how do we take this? What's their thinking in terms of how we take the process forward. So I'll start with the ruling party, APCMR. Can somebody help me to give them a phone? Okay. My campaign times, but
all right. Thank you very much. Actually, I've learned a lot. You know, the APC is a political party that is driven by setting their priorities right, and health sector has been our primary objective. So coming today to see what health sector has been doing, and the media has not.
One house, please. Go ahead.
We have not been propagating, the media has not been propagating our strengths and our weaknesses well for the masses to really understand what health practitioners have been going through. The health agenda has been articulated today. My own take is one. I will revert back to the leadership of the party, ably led by His Excellency Senator Abdullah Adamu, and inform him of some of these proposals that have been raised today, so that we can integrate it in our manifesto. The manifesto we earlier formed in 2014, where we look at the realities of 2014 then. But we are in 2022. We have to also see how we can integrate it and update our manifesto. So it's a welcome development. I appreciate the organizer of this forum, and I want you to please don't relent your effort in working for the progress of our dear nation. And two, I want to assure you that we will partner with you in any way possible to make sure we get our health sector right. Thank you.
Great, thank you very much. That is hard for me to know. So quickly to the PDP. Give it to Madam over there. Great. I'm very sure Madam will try to surpass the commitment of the APC.
Well done, everybody. First of all, I want to appreciate the forum for recognizing PDP and inviting us to this occasion. Thank you very much. First of all, we are talking of health, and health is wealth. As we have all seen today, from here on, I will take it to the national chairman. By the time your report comes out, though PDP have done it before, when we were in power, you know how the health sector was. You cannot compare that time with now. So we are in bad, we have gone past. In short, I don't know the adjective to qualify it. We have done it before. We are not afraid of it. Once we get to power, by the grace of God, come 2023, we will take you and we'll move forward. You know how we tackle with all the sicknesses that we are in the past.
Okay,
so by this time, we are, sorry, don't cut me off. This, we know how to do it. We have been doing it. We are not learning. So, and we leverage on it. And by the grace of God, come 2023, we will move this country forward. And then again, anytime you call upon us, we are always ready to accept. We are always ready to come for your invitation. We'll partner with you whenever we are called upon. Once again, thank you.
Okay, thank you very much. Thank you. That is reassuring. And what does that tell you? The election debate in 2023 is going to be very, very interesting because we have the political party engaged now, so they'll come and tell us what they have in stock for us. So, but I would like to crave your indulgence, please. I'm very happy you are going back to tell your various, your chairman please, you have to pave the way for us because the forum would like to pay visit to the leadership of the two political parties as well, to engage them with this and others. I know why he's in and others. So thank you very much. I really appreciate your comment. So quickly, Ayomide will come and tell us, summarize quick next steps. What do you want to do? And the Honorable Usman will give us closing remarks. Okay.
Thank you, sir. Good afternoon, everyone. So from all that we have discussed and worked on today, some of our key next steps. So we've agreed to set up a 5-man technical and political committee that would sit down to further work on the health agenda that we've developed today to harmonize everything and refine it to be more politically appropriate, like we said, to have 2 versions, one for the national level and also the one that will serve for the subnational level government, and also to include, more political incentives as part of the health agenda to make it more sellable to the political class. Then after harmonizing, we share with everyone to further get your review and concurrence, then form an advocacy group that would lead the presentation and dissemination of the health agenda to the different political parties, like Dr. Gafar just mentioned, and also will disseminate to the media, which they would also use in engaging the political class throughout the campaign period. Thank you very much.
Great, thank you very much. Thanks for the summary. Just to quickly highlight that in the next few weeks, after we must have reviewed the agenda, we'll be meeting with the media. We'll communicate the date and the venue as well. Honorable Usman, please come and give us a closer remark. Thank you very much, sir.
Good work. Good going.
I think let me start by thanking each and every one of you for a very wonderful job you see done. The program, I believe, has been very exciting, very insightful. We have really learned, you see, a lot. And I believe we'll be able, to move forward. Secondly, let me assure members here that here, let me go a little bit political. And majority know where I belong to. I belong to the APC group. And I have already started this conversation with our new chairman. I used the opportunity during the campaign period to raise this with him. And even God willing, by next week, I'll be meeting with him. I will equally raise this issue with him. And Dr. Gafar, I want you to give me maybe a draft letter or whatever, congratulatory, even though you did it really. I would want another one so that by next week, when I meet with him, to give Mr. Chairman. So that's just to let you know that the ball has already been kicked. And this time around, we are going to get it right. Why? Because people will give so many. When you read papers, they say, well, our national chairman was before of the PDP bloc. Yeah, we're not afraid shying away from saying that. Even I myself, first 12 years, I was also in PDP but things did not go right. So at the same time, we decamped and formed the APC. So he has these requisite experiences to use, catalyzing by making things work within the next 8 years. If God willing, we are able to form the next government in Nigeria. Thank you all, and the best. God bless you all. So nobody clap for me because
So let's give Honorable Usman a stronger round of applause, please. So on this note, I would like to thank each and every one of us for this contribution. But one house, please, one house. And at the same time, I would like to congratulate us for being part of history. We have been part of the history towards resetting the health agenda in this country and have a health system that we actually desire. We have learned from what people have done in the past, and that we have identified what we want to do differently. I would like to please tell us that there's a huge work ahead of us to do. We have listened to different people. They have advised us in terms of what to do differently. So I congratulate you for being part of history. Let's continue to work together so that we achieve the desired goal. I would like to first and foremost thank Nigerian Governors Forum Secretariat for supporting us. We're in it together, but of course we really appreciate their partnership from the chair of the forum to the head of the secretariat. We really appreciate their partnership. When we visited, they expressed interest and they have been contributing towards that. So, Dr. Hamad, and thank you very much. It's because of your buy-in. That's why we are having this support. To each and every one of us, Lafayette Project, Honorable Osman, and everybody have fun. Please, like we said, we're in it together, and the political parties as well. To Oga Mike Egbo, and each and every one of us, my mommy, Auntie Lola, Dr. Auntie Muji, and others. So we really thank you very much for your contribution. We've been here since morning, and we've actually contributed very well. Because we have done very, very well, I think we deserve lunch. So now, it's performance-based. So, so because we've done very, very well, we deserve lunch. And I can assure you that I will try as much as possible to attend to those next steps, so that when next we have a gathering, we'll see that we have a near perfect health manifesto. So thank you very much. And I think we started with prayers. We would like to ask Dr. Celestine Okore to give us a closing prayer, then we'll depart. Thank you very much.
On my lunch through Mark to bring to me.
Sorry, we thank our virtual audience as well. Thanks for participating since morning. We really, honestly, I'm so excited with even the quality of contribution from our online participant as well. Thank you very much. I hope you join us next time.
Sure, we will join you.
Yeah, by God's grace, we will join you.
Give my cable my lunch to bring to me.